1:30, I'll start the roll call. Although the good news is it looks like we've got, I think, all the board members here. So here we are. Are we live now, staff? Is this being televised?
I believe we're live unless somebody says otherwise.
Okay, excellent. So good afternoon to my colleagues and staff and the public. I'm Megan McLaughlin, meeting manager this afternoon, along with my awesome co-pilot, Laura Jane Cohen. And before we get started with staff presentations on the return to school discussion on the superintendent's proposed timeline, I do want to take the brief roll call and make sure everybody can be seen and heard. So I'll start at the top. Ms. Omish?
Here.
Great. Ms. Tolan?
Yes, I'm here. Thank you.
Ms. Corbett-Sanders?
Looking forward to this discussion. Thank you.
Mr. Frisch?
I'm here. Thank you.
Ms. Marin?
Here.
And of course, Laura Jane, let's check your mic. You all set?
Right here with you.
Excellent. And Nathan Onabudo?
I'm here, Ms. McLaughlin. How are you?
Welcome. Glad you can join us. Dr. Anderson?
I'm here.
Great. Stella Prakarsky?
Hi, I'm here.
Yay, good to hear your voice. Hopefully your connection stays for you today. Tammy Koufax?
Here, Ms. McLaughlin.
Great. All right, then we're all set to go. In terms of how we're going to proceed, Dr. Brabrand, what I would like to do is have your staff go ahead and briefly present. And then when they've concluded, my colleagues, I just want to set a little bit of process housekeeping rules on how we'll proceed with board member time. So with that, Dr. Brabrand, you ready to take the mic?
Yes, ma'am. Yes, ma'am. Yes, Ms. McLaughlin, I'm ready. And we'll move through as quickly as we can and leave the majority of time for your questions. So good afternoon, everybody, school board members and members of the community. This is our return to school update for February 2nd, 2021. And I want to let you know here at the beginning that much has changed since our last return to school update. Our COVID cases and percent positivity in Fairfax County were among the highest risk level and climbing when we met in January. Those numbers I can share with you are now on a downward trend. The Virginia Department of Ed and Department of Health published updated guidance January 14th after our return to school work session for their guidance on returning students to schools, including explicit health decision-making guidance that we'll be sharing with you again today with additional detail from the work that we had done already with Dr. Gloria and the Fairfax County Health Department. The Fairfax County Health Department and ANOVA have partnered with us in a wonderful partnership since our last return to school work session to begin vaccinating all of our public and private school educators, including all of our staff in Fairfax County Public Schools, with the first shots beginning on January 16th and are continuing now, even in some of this weather that we have. And our first groups of FCPS students returned last week for in-person intervention supports. These are positive changes, and we are very confident these positive changes will continue to move us forward. And it gives me great confidence in the plan that I will be sharing with you today on behalf of our leadership team, our entire school system. It is our desire to return all of our students to in-person learning by March 16th for at least 2 days a week of in-person instruction. We acknowledge there are other developments that continue to be something that we need to monitor here in our community and around our country, such as new variants of COVID-19, looking at some emerging recommendations around double masking, and the challenge of the vaccination process and sometimes supply challenges. We will always continue to monitor and seek guidance around these issues with our Fairfax County Health Department on these emerging factors. However, our return to in-person plan that we are presenting today is not impacted by these issues at this time. I'd like to go ahead and show the presentation objectives. This afternoon, we're focused on 3 areas for our updates: our decision-making model for in-person learning, that's that VDH updated model that we'll be sharing with you, our staffing and operational updates, and a timeline for returning students to in-person instruction, which I shared with you earlier at our January 21st school board meeting and have shared with the public for the last couple of weeks. As you recall, at the last school board return to school work session, we shared a model that we had been working on with consultation of the Fairfax County Health Department for determining when in-person learning would occur. And on January 14th, the Virginia Department of Ed and the Virginia Department of Health provided interim guidance for reopening pre-K to 12 schools, which included a health model that was very similar to the version that we had been working on with the Fairfax County Health Department. So we've now worked with the Fairfax County Health Department to incorporate that state guidance in our local model. And I'm so excited about Dr. Boyd sharing that update with you today that will not just guide us tomorrow or next week or next month, but will really be our guide for the foreseeable future as we continue to move forward in this challenging situation that we have. We'll also provide an update again, as I said, on staffing and operational metrics, as we have in all previous work sessions. And I will share the in-person timeline, as I mentioned already, that already has some students back in school for interventions and will be returning groups 1 through 8 from mid-February through mid-March. Our plan remains a phased and measured approach that ensures mitigation strategies can be implemented with fidelity as the number of students in our buildings increases. While vaccinations are an important mitigation effort against the spread of COVID, the CDC continues to advocate that all persons follow mitigation measures at this time. So I'm going to go ahead now and turn it over to Dr. Boyd, our Assistant Superintendent for Special Services, to provide an update on our decision-making model for in-person learning. Dr. Boyd.
Good afternoon. I'm trying to activate my camera. Give me one moment. Hopefully it'll pick up here. All right, I think we're ready to go. Thank you, Dr. Bray. I appreciate that. And good afternoon again, everyone. In preparing to review our FCPS data regarding COVID-19 and in preparation for reviewing the updated in-person instruction decision-making process, it's important for us to review the terms EpiLink and Outbreak as they are referenced in our data and our decision-making model. When a case is referred to as an EpiLink case, it means that a case in which a patient has or has had contact with one or more persons who have or had the disease and transmission by an agent through usual modes of transmission, for example, spread of respiratory droplets, is plausible. Outbreak is another key term in our decision-making process and is often used in discussion when the term EpiLink as a school outbreak is 2 or more lab-confirmed cases among students or staff with an onset within a 14-day period who are EpiLinked, do not share a household, and were not identified as close contacts of each other in another setting during a standard case and contact investigation process. As we look at our updates for FCPS by the numbers, during the time span of September 8th through January 30th, the large majority of our in-person students, staff, and visitors, approximately 93%, have not reported being COVID positive. However, there has been 888 in-person students, staff, or visitors, which is approximately 7%, that have reported being COVID positive. 799 of those 888 cases, or 90% of all cases, reflect community transmission whereby students, staff, or visitors contracted COVID in the community and entered our schools or offices, but did not transmit the virus to others in school. 89 of the 888 cases, or approximately 10%, reflect transmission in schools. And again, those are those EpiLink cases whereby a staff, student, or visitor contracted COVID, and transmitted the virus to others in the school or offices. The 89 of the EpiLink cases reflect 30 outbreaks in schools, in which 17 were in academics, 11 were in athletics, 1 was in an office, and 1 was within SRS. Within academics, the majority of our transmission continues to be staff to staff. Within athletics, the majority of transmission is athlete to athlete. As has been shared in previous updates, the implementation of mitigation strategies continues to be our best defense against the spread of COVID-19 in our schools. We are also fortunate to have access to vaccinations as members of Group 1B to assist in supporting the healthy teaching and learning environment. We're excited that FCPS staff have had the opportunity to access vaccinations through the joint efforts of the Fairfax County Health Department and ANOVA. As of January 25th, over 7,000 FCPS employees received their first dose of the vaccine. Based on the FCPS survey that was disseminated on Sunday, January 31st, 8,738, or 65 of respondents as of noon today, 65% of respondents as of noon today, indicated that they have received their first dose. We continue to partner with the health department and ANOVA, and they continue to make appointments for first dose vaccinations available. We are extremely appreciative of this partnership and thank staff for the grace as we work through this new process. It is important to note that while vaccinations are underway, implementation of mitigation strategies remains paramount as we have not yet achieved herd immunity, and research is still being done to determine if the virus can be transmitted from vaccinated persons. As a result, persons will continue to be required to quarantine if they are identified as close contacts in the contact tracing and contact investigation process. As a reminder, our 5 key mitigation strategies are consistent and correct use of face masks, and that masks are covering one's nose and mouth, secure under the chin, and fit snugly on both sides of the face. Social distancing to the largest extent possible, maintaining at least 6 feet between people when possible. Hand hygiene and respiratory etiquette, hand washing with soap and water at least 20 seconds, covering our coughs and sneezes with a tissue and washing our hands immediately afterward, and using hand sanitizer with at least 60% alcohol when soap and water is not available. Cleaning and disinfecting, ensuring that we're cleaning those frequently touched surfaces. And last but not least, contact tracing and collaboration with our health department. Our firm foundation of all of our key mitigation strategies is anchored in persons staying home when they're sick. Prior to reviewing our updated decision-making model, it's important to note that our decision-making process has evolved as our expert guidance has evolved. As you'll see on the timeline here, in May of 2020, the World Health Organization referenced the 5% threshold when recommending to governmental bodies that they open. In July of 2020, CDC used the threshold of 5% when referencing hotspots. In July of 2020, VDOE released the phased guidance for schools that provided guidance for school divisions regarding operation statuses and recommendations when with each of the phases identified in our phase guidance. In September of 2020, the CDC released the indicators for dynamic school decision-making, and that included the 3 core CDC indicators as well as secondary CDC indicators. And most recently in January 2021, VDOE and VDH released the interim guidance for reopening pre-K through 12 schools, and that guidance showed how to apply the 3 core CDC indicators as well as school factors and making it recommendations for levels of in-person instruction based on overall risk in schools. The most recent resource to support the decision-making is the updated guidance from the Virginia Department of Health and the Virginia Department of Education. The new guidance advises that schools consider the following to determine risk in schools: implementation of mitigation strategies and/or the level of school impact, and the number of cases per 100,000 persons within the last 14 days, and or percent of PCR tests that are positive within the last 14 days. The guidance or model is very similar to the decision-making model shared in December that was developed in collaboration with the Fairfax County Health Department. Since the release of the VDH-VDOE model, we have made minor revisions to our proposed FCPS model to more closely align with state language. As indicated on the table presented, both the updated FCPS model and the state model include the number of cases per 100,000 persons, percent positivity, outbreak data, and staffing. However, the updated FCPS model does not explicitly include mitigation strategies and does not include student absenteeism. Mitigation strategies are extremely important in keeping students and staff safe. As a result, mitigation strategies are promoted widely through media campaigns and are reinforced through professional development and lessons for staff and students respectively. Further, FCPS safety teams continue to serve as a resource for ongoing capacity through school visits and data dialogue with school-based administrators. Because the goal or intended outcome of implementation of the 5 key mitigation strategies is minimizing or eliminating transmission in schools, referred to as outbreaks, the metric that is included in our decision-making model is outbreaks, the outcome, not the process implementation of mitigation strategies. Student absenteeism, while included in the state model, is not included in the FCPS model. The intent of this metric in the state model is to compare student absenteeism for illness pre-COVID to present to determine the degree the student illness may be impacting schools now. FCPS has a number of attendance codes, such as a medical code for doctor's appointments, dentist appointments, and therapy. However, we do not explicitly have a code that is used solely for illness. As a result, we do not currently have a student illness baseline to be able to appropriately incorporate the student absenteeism metric. Irrespective of the small variation between models, the Fairfax County Health Department believes the FCPS model remains strong. We'll now take time to unpack our updated FCPS model for in-person learning decision-making. The model includes 2 large categories: level of community transmission and level of school impact. The first category, level of community transmission, includes 2 criteria: the number of new infections per 100,000 persons and the percent positivity. The first category is broken up into 3 risk levels. The first level is lowest, lower, and moderate, represented by number of cases per 100,000 that are less than 50 and percent positivity that's less than 8%. The second risk level is higher, represented by the number of cases per 100,000 being that between 50 and 200, and percent positivity being between 8% and 10%. The last risk level in our level of community transmission is highest, represented by number of cases per 100,000 persons greater than 200 and percent positivity greater than 10%. At any time when the risk level from the number of persons 100,000 and percent positivity differ, we always use the most significant risk level to associate with our overall risk category for that category. So in the case whereby the number of cases per 100,000 would be in the higher risk level and the percent positivity in the highest risk level, the overall assessment for level of community transmission would be highest. Our second category in our decision-making model is the level of school impact. This category includes 2 criteria: transmission within schools, otherwise referred to as outbreaks, and staff capacity. Again, there are 3 risk levels. The risk levels here are low, medium, and high. In terms of outbreaks for transmission in schools, low is defined as 0 or sporadic cases with no evidence of transmission in school. Medium is defined as 2 outbreaks within a short period of time. And in FCPS, we have identified short period of time as being 14 days. or sporadic outbreaks in school, and the size of the outbreaks remains small. For high, several outbreaks in school within a short period of time. The size of the outbreaks is large in scope, indicating that it impacts multiple classrooms or grade levels. You'll notice an update here. In our prior decision-making model, the outbreaks were classified solely by the number. Here, outbreaks are identified by number and/or the scope of an outbreak. Regarding staff capacity is determined as low if staffing is normal, medium if staffing is strained, and high if staffing is critical. And we'll unpack later what normal, strained, and critical are defined as. As with our first category, if the risk levels associated with outbreaks in schools or transmission in schools is different than that for staff capacity, we would apply the one with the most significant risk level to the overall risk level for school impact. For example, if our transmission within school was low and our staff capacity was medium, our overall assessment for the level of school impact would be medium. We now go and look at our current data as it relates to community transmission in our first category of that is reflected on the screen here. You'll notice that as of February 21st, our number of cases, 100,000, were 444.2, and our percent positivity was 10.4, both being in the highest risk levels. Based on the data presented, our level of community transmission, the overall risk for our first category, would be at the highest risk level. As the second category, level of school impact, we'll first unpack our outbreaks. As of January 30th, 181 schools have had 0 outbreaks in academics or in SRS. 8.5% or 17 schools have had 1 outbreak in academics or in SRS, and 0.5% or 1 school had 2 outbreaks in academics or SRS. When applying the definitions for each risk level for the outbreak in schools criterion, all FCPS schools fall within the low risk level as no schools met the following criteria. No schools were identified as having 2 outbreaks within a short period of time, which would determine our medium risk threshold, and no schools were determined as having several outbreaks within a short period of time or outbreaks that are large in scope as defined for our threshold for high. As we look at our second criteria within our level of school impact category, staffing, we currently fall within the normal range as defined as work being able to be completed with staff working within their designated roles with reassignment or additional duties commensurate with pre-COVID operations. And looking closely at the definition for medium that was referenced earlier as strained, strained is defined as work being able to be completed by temporarily deploying or reassigning staff, and critical is work being unable to be completed due to lack of staffing. At this time, all schools are classified as being within the low threshold for our level of school impact. As we go back to applying our overall decision-making model based on our level of community transmission, with the assessment being in the highest category, and our level of school impact and looking at our outbreaks and our staffing, our overall assessment for our schools at the level of school impact is at the low risk level. As we apply our decision-making model, we look at the intersection between our level of community transmission and our level of school impact. All FCPS schools will have the same level of community transmission as that's based on our Fairfax County Health Department data. So again, as of this time, all of our schools would fall within the highest category. And so we would start by looking at the last column in the highest risk level. We then make individual assessments of each school based on outbreaks and based on staffing. At this time, our level of school impact for all of our schools falls within the low category. And so we look at the intersection of the highest column, our last column in our first row where it says low, and our students would be priority learners in person where additional groups are added as capacity allows. In our updated decision-making model, priority learners are defined as students in groups 1 through 6. As we look more closely to the updates that have been made to our overall decision-making matrix, we have made some revisions to align our language with that reflected in the state model. You'll see that there are 3 opportunities where we would have maximum in-person learning, being that all students who opted to be in school would have the opportunity to do so with the implementation of our mitigation strategies, including the social distancing in place. Those are those 3 categories listed in the light green boxes that reflect higher community transmission and low school impact, and lowest, lower, and moderate community transmission and low level of school impact. And last but not least, lowest, lower, and moderate levels of community transmission and medium impact. We then have 3 opportunities within our decision-making matrix whereby priority learners would be in person with additional groups being added as capacity allows. That's reflected in the peach color boxes that are listed with the highest levels of community transmission and low level of school impact, higher level of community transmission and medium school impact, and lower, lowest, and moderate levels of community transmission and high impact. We then have 2 opportunities in our decision-making matrix where only priority learners or those students in FCPS in groups 1 through 6 would be in person, and that is reflected in the golden boxes. And that's listed in the opportunities or scenarios where there would be the highest levels of community transmission and medium levels of school impact and higher levels of community transmission and high levels of school impact. There is only one scenario in which all students in FCPS would be remote and engaging in virtual learning, and that's reflected with the highest levels of community transmission and high level of school impact. We'll now look to an example. Given the example of XYZ Middle School, XYZ Middle School has 636 cases per 100,000 persons, which reflects highest levels of risk, percent positivity at 8%, which reflects higher level of risk. Based on our process of applying the most significant risk whenever the 2 criteria have different risk levels, we know that the overall assessment of our level of community transmission for XYZ Middle School is at the highest risk levels. And looking at the level of school impact for XYZ Middle School, it constitutes medium for their outbreaks. So they've had 2 small outbreaks within 14 days, and their staff capacity is at the low risk level as they're able to get their work done commensurate with pre-COVID operations. Again, based on our assessment and our process of applying the most significant risk level whenever the risk levels are different, we know that the overall risk level for the level of school impact for XYZ Middle School is at the medium level. As we look at our decision-making matrix and we find the intersection of highest for community transmission and medium for level of school impact, we would see that XYZ Middle School would have priority learners in school. And if this were an FCPS school, that would include learners in groups 1 through 6. We want to take a look at one more example. And looking at ABC Middle School, the level of community transmission, our number of cases is 636, again at the highest risk level. Percent positivity is 12%, which is also at the highest risk level. So our overall assessment for the level of community transmission for ABC Elementary School is at the highest risk level. And looking at the level of school impact, ABC Elementary School has 0 outbreaks, indicating a low impact for outbreaks. And staffing is high because their work is unable to be completed due to staffing. Based on our process, we apply the most significant risk level because our risk levels are different within one category. As a result, the overall risk level for the level of school impact for ABC Elementary School is high. As we look at our decision-making matrix and we find the intersection between the highest for the level of community transmission and high for level of school impact, we find that ABC Elementary School, all students would temporarily be remote. As a reminder, in addition to our decision-making matrix that we've just reviewed, there may be situations where classes are temporarily transitioned to virtual instruction while groups are in person due to health reasons or due to operational challenges. We will make sure that those classes resume in person upon the advisement of our health department, and we will resume classes that were paused for operational challenges as soon as those operational challenges were resolved. That is commensurate with our current operations plans as we had begun our phased return. In summary, our decision, FCPS proposes that we would use the adapted VDH and VDOE decision-making model that's been shared with you on this afternoon. Decisions regarding our in-person instruction would be based on community transmission, outbreaks, and staff capacity. Decisions regarding our in-person instruction start dates for student groups would be made and continue to be made at the division level. Individual factors such as outbreaks or staffing may temporarily impact a school's ability to add or maintain groups for in-person instruction. That information will be communicated to families via the school principal as soon as possible, and decisions when to resume, pause, in-person instruction due to outbreaks would be made by the superintendent's designee in collaboration with the Fairfax County Health Department. Last but not least, priority groups in FCPS, groups 1 through 6, would remain in person unless both the level of community transmission and school factors were at the highest risk levels. At this time, I would like to turn it over to Sean McDonald, our Interim Assistant Superintendent for Human Resources, to provide an update on staffing.
Great, thank you, Dr. Boyd.
Pardon me, I'm so sorry, Mr. McDonald. This is Megan. Just quickly, I want to do a time check for everybody. We've been going for about 30 minutes now. We do have about an hour and a half, or at this point, 2 o'clock. We've got about 2 hours left. So I just want to make sure we can move through the slides as much as we can to save time for the dialogue. So thank you, Mr. McDonald.
Thank you, Ms. McLaughlin. All right, so on this slide, the chart on the slide provides an update on the progress made with ADA requests. As of January 27th, FCPS has received 3,111 employee requests for accommodations. At the January work session, we reported 90% of ADA accommodation requests had been resolved. More recently, we currently sit at 93% resolved. Of the 2,885 resolved ADA accommodation requests, less than 1% have been denied. We continue to receive new requests daily. However, the rate of submission has slowed significantly. HR will continue to engage employees with outstanding ADA requests in the interactive process. Additionally, our team intends to track and report data related to the number of employees who withdraw their ADA request due to taking the COVID vaccination. FCPS has been actively recruiting classroom monitors since the position posted on October 31st. The table on this slide provides a breakdown of the classroom monitors needed to support in-person learning by student group and the progress made towards filling those needs. To date, classroom monitors have been hired to fill 640 positions, an increase of 193 since our January work session. However, we still have a need for 205 additional monitors. We will continue to monitor our classroom monitor needs closely. In an effort to recruit monitors to fill all remaining vacancies, HR will host our third virtual job fair for classroom monitors on February 12th. Our previous events have been a huge success in recruiting new monitor candidates and matching existing candidates with schools. We continue to advertise our need for classroom monitors broadly. In previous work sessions, I've shared our extensive efforts to cast a wide net to include social media advertisement, outreach to college campuses, advertising in community job boards, and utilizing the existing job board network within our applicant tracking system. Since the January update, we initiated a new outreach via radio ad on iHeart radio streaming service. This ad ad ran in the Washington, D.C. metropolitan area market and reached an estimated 25,000 people. As students groups return to in-person instruction, our plans to address gaps between classroom monitor needs and hires include flexibility for schools to compensate teachers who volunteer to serve as a classroom monitor during their self-directed planning period, and deploying central office staff to provide temporary classroom monitor coverage as needed. And I'd like to acknowledge the fact that a number of central office staff have stepped forward and volunteered to help with this need. I would like to now turn the presentation back over to Dr. Braybrand.
Thank you, Sean. Let's go over the in-person return to school timeline. As a reminder, I shared it with the board on the 21st. There are no changes to this timeline since that meeting on the 21st. And I want you to know we've done considerable stakeholdering to ensure this plan can be operationalized. Our principals are ready, our staff is ready. We are ready to implement this plan. We did one-on-ones with school board members. We did 2x2s with region assistant superintendents and board members. I've met with principal associations, teacher associations, our teacher advisory committee, STAC, our return to school task force, and we have shared this timeline. We are ready to move forward with this timeline. Some would like it a little quicker, some would like it a little longer, but it is a timeline that reflects considerable stakeholdering through all of the key parts of our community, and we are ready to implement this timeline. I also want to just share a brief piece of information with you about the work that we are already doing, even as we are doing return to school in person, that schools have put a number of action plans to support students who have academic and social emotional needs in place. And that includes tier 1 supports during class, whether those interventions are in person or virtual, conferencing with families and doing home visits, direct social emotional instruction, including check-ins and home visits, and case managers looking at student data, including those of our students with disabilities, and making sure that we are looking at recovery services for those students. And we're going to keep analyzing data to help us make sure that we are reaching out to families and their children to give them the support they need. I want to just show you our in-person instruction phase-in status. We did have school readiness cautions for Group 8 as we had schools that needed to resolve challenges adhering to our social distancing requirements that the health department continues to advise us to maintain. But I'm pleased to report on that operational and school ready staff metric that our principals, leadership team members, and facility teams have worked to identify solutions to those challenges, and we have resolved the outstanding issues. And you can see we, on the operational metrics of school and staff readiness, are go across the board, as we are for the risk of transmission in schools, where you've already heard Dr. Boyd share our model and share the FCPS data, that we are a go across all groups. We do have a remaining caution for groups 7 and 8 as we continue to do the staffing for classroom monitors, but we have made tremendous progress. And kudos to the HR department and our principals for aggressively hiring and working on these additional stopgap strategies to address the shortfalls of our staffing and to support our returning our students for in-person instruction. We are continuing to work on this, and I'm confident we will make continued progress as we get closer to those return to school in-person dates. In summary, Fairfax County Public Schools is ready to bring back students to in-person instruction. We have a return to in-person learning plan developed with multiple stakeholders, and it's consistent with CDC, VDH, VDOE, and Fairfax County Health Department guidance. We'll continue to update this plan to make sure it continues to align with the recommendations of our health officials. This is a robust plan that makes sure that we implement mitigation measures in our schools, including education, monitoring, feedback, to make sure our schools remain a safe place for learning. This is a timeline that is supported by our principals, who are the ones who will have to implement this day to day with their teachers and counselors and support staff, and deal with the day-to-day challenges that we know will arise as our students and staff come back for those first days in person. But we are confident, they are confident they can make this timeline work. We acknowledge that no situation is risk-free, but the risks are far greater in not returning students at this time. The data is becoming clear with every day that our students need to return to in-person instruction. We have students who need that for their academic and social emotional well-being. We have families who need to return in person, but we'll continue to offer, of course, for families the online choice. And we have been able, for staff who wanted to be vaccinated, many have already received their first shots. We prioritize by working with the health department, our entire FCPS staff, and we're continuing to move through the vaccination process. Now's the time to unify and move forward with this plan to return our students back to in-person instruction. I ask for your support. This is what we've been working tirelessly toward for months. We brought some kids back in the fall, but this is a plan that returns all of our students back. I hope at our next return to school work session on March 16th, I'll be able to report that all of our grade levels have returned successfully to in-person learning. We have the right model for returning. We have the right timeline for returning. Now is a moment that I ask this board and community, after months of division with the crisis of this pandemic, that we come together, that we unify and unite. Our president has asked for this, and we must come together now and say it is time for our students to return to in-person instruction. We're ready. We have the plan. We have the timeline. And I look forward to moving forward with this timeline after your questions and discussion. Thank you very much.
Thank you, Dr. Brabrand. I appreciate not just the thorough information your staff brought, but your strong closing remarks about where we are. And so for my colleagues, as I begin to see who wants to begin, just process-wise, we do have about an hour and 45 minutes for each of us to have an opportunity to speak and ask questions and comments. And then depending on where we are from the first round, we'll determine how much time is left for the go-backs. But with board members, do bear in mind that the more questions you ask and the more staff responds, that does play a role in our timing. So just to set the stage again, this is a work session for board members to gain information, but also to communicate with each other and the superintendent on where we are with his proposed timeline. And Dr. Brabrand, I just want to set that collegial tone that we've talked about that's so important among the board members, among your leadership team, your principals, all of our employees. We recognize it's a complex issue. We recognize that we all come at this with a different interpretation and perspective on the data that we're using to drive these decisions. And so as one board member, I just want to say that I hope we'll continue to recognize that every single one of us involved cares about kids. We care about our employees. We're just trying to make the best decisions possible. And I hope we can focus our remarks in that manner and that everyone's going to feel respected by the time we wrap up today's conversation. So
thank you. Thank you very much.
Yeah. So with that, I'm going to begin with Ms. Corbett Sanders, followed by Mr. Frisch, unless Ms. Laura Jane Cohen, did you want to say something quickly?
I'm sorry, I just wanted to make sure, because I just gotten several messages, just we had agreed, I think we came to consensus, so you please direct me if I'm wrong, about that we'd be having this conversation here, but a vote would be held on Thursday night in our regular meeting, which is a goal that we all have, to change voting from work sessions to getting into regular meetings.
Correct. And depending on how today's work session conversation, I think the chair and vice chair will work with the superintendent about ensuring that we have the correct proposal on the table and just for something formal for the public to know that the board's support for how we'll proceed. That was the goal. for Thursday. Please proceed, Ms. Corbett Sanders.
Thank you. And I'm glad for that clarification, although I hope that by the end of today's meeting, we have a general consensus that we will be moving forward to having our students back in our buildings. I do want to clarify that this is really about returning to our buildings. Our students are learning, maybe not in optimal situations, but they are learning in our virtual setting. I am a little, I would love to have a little bit more detail and explanation about, description about what our students in middle and high school will be doing on a daily basis, how those hallway transitions are going to work, and how lunchtime is going to work across all three. But I am so very appreciative of the excellent work that has been going on by our staff in getting us this, this calendar. It was very helpful to see the operational metrics just a couple of moments ago. So I do have a couple of questions about that. It said that we have our highest level of vacancies for classroom monitors in the grades 3 through 6. Is that something that Dr. Bray, you took into account when you developed your schedule? Did we lose Dr. Brabrand? So perhaps Dr. Ivy?
Sure, I'm putting on my camera. We lost Dr. Brabrand. I'm sure he's trying to reconnect. It is one of the considerations that we did think about, Ms. Corbett Sanders, in developing that timeline, you know, for elementary. And the thinking was by having those 2 weeks between groups 5 and 6, one, it allows for additional time for those youngest kids to get acclimated to school and to get the processes and routines and adjustments made to the building. And second, it would allow our principals an additional week in which to make sure they not only secured the monitors, hired them, and also trained them.
There's 46% vacancy rate there.
That's right, Ms. Corbett Sanders. That's our biggest rate. That last group of grades 3 through 6 is our biggest area still for hiring. And so this gives us more time to make sure we make that mark for staffing so that we can meet the dates that we've shared with our community.
So based on that, Dr. Brabrand, a third question. So I asked about transitions and the process for transitions and cafeterias or lunchtime. The third area is how are you going to triage situations where you said certain schools may have to close because of operational conditions of not having enough staff? How are you going to triage that? Because I know you were very helpful in making sure that between our January work session and today that we had the staffing we needed for the Mount Vernon schools, which was why I had supported the pause before.
Yeah, well, we're in really good shape. I mean, we are moving along at a great clip. If you compare a month ago, the staffing situation for monitors, and then compared it to a month before that, we made tremendous progress. We are closing in. We also have set up a program for temporary central office support for schools that at the beginning are short on staffing. So we're going to have a legion of folks to come in as we approach these days to provide support as we're finalizing maybe those last few monitors. But we're going to continue to do those 2x2s that we've done with you all as board members, so you can have your fingers on the pulse of how things are going as we begin to implement. And of course, we're going to update the board with that each month of how it's going. We do, you know, none of us have been here before, but we are confident that we have got the systems in place to really try to make sure the staffing challenges will be a minimum.
And if I could just add, the region offices are working side by side with each school and monitoring it closely. And in some cases, having daily meetings, and when need be, that they are calling in our HR specialists to help and assist, and other departments with whatever the need might be.
So one last piece, I now understand your triage, but I still haven't heard about the hallway passing and cafeteria, as well as are we doing anything on surveillance based on President Biden's plan?
Thanks, Ms. Corbett-Sanders. By the way, I apologize. I got bounced out, and so I'm calling in on my phone, and I'm trying to prevent future bounce outs by talking just audio. Dr. Boyd, I think you can share some of the guidance that we've given around our cafeteria and food use, and a little bit about hallways. Do you mind sharing a little bit of that with Ms. Corbett-Sanders?
Certainly. Good afternoon. We have provided some updates to our principals regarding cafeterias. The expectation for mealtime, certainly we know students would have their mask off, is for students to be at least 6 feet apart and to all be facing one direction. We are providing some additional follow-up and some additional collaboration for our schools that have round tables. Some of our schools have round tables in their cafeteria and do have plexiglass. So we're just confirming with the health department that that will be okay to utilize those. But we do have some firm expectations around 6 feet social distancing while masks are off in order to support safety. And so that's the expectation for the cafeteria. For the hallways, a number of our schools are implementing various things. Some folks have things set up for one direction in terms of class changes and things like that. But that has really been implemented more on a school by school basis. But we do have principal work teams led by our EPs to really work through some of those operational logistics to take into account the variation between school buildings and between levels, to work through those logistics so that the principal voice is truly apparent in that process and is being facilitated by persons who were most recently in the principal role and very connected to day-to-day operations.
And we're also advising schools to maximize outdoor space whenever possible during the lunchtime.
So I would just urge we communicate these processes to the public, not just one and done, but often. And I would just urge on the 316 session that we focus on summer remediation and learning loss, because hopefully our kids will be back in by then. Thank you.
Yes, absolutely. We'll do that.
I think we might have lost Ms. McLaughlin. Mr. Frisch, you want to go? Oh, sorry, Megan.
No, it's all good. You tagged me in. So yes, Mr. Frisch, you're on deck. And then board members, I don't see any other hands up, so please start to get in the queue. Please go ahead, Mr. Frisch.
Thank you. I'll start by saying I'm generally supportive of the timeline as presented, though I do have some concerns about mitigation strategies that I'll get into in my go back. Vaccinations have been one of the things that we've talked about, as I think the superintendent has indicated that they've resulted in some teachers seeking to drop their ADA or leave of absence requests. And if that continues, obviously that helps from an operational perspective. So I'd like to dig into our vaccination strategy. In January, we were informed that we had 5,000 people receive their first shot in that first week, and that 90% of our staff had signed up to make appointments. Obviously, there have been some hiccups along the way, but I do have some questions. First, it was right to prioritize vaccination by group. Why didn't we take it a step further and prioritize vaccination within group by those who would be in person or working in the buildings?
Well, thanks, Mr. Frisch. I'll go real quick, and if anybody wants to add, our health department came to us and said, we are committed to getting your entire FCPS family vaccinated. And so when that was the offer on the table, it made it easier to begin to turn from having the supply of vaccinations to then turning around and getting that started immediately. We didn't really even have a system in place that would have allowed us to easily divide between those that were in person scheduled or those that were virtual. So at the very beginning, the offer was all inclusive. And so we went that way. And I have appreciated that continued it. Then we had the change in who was doing the distribution, which was a glitch. But I can tell you, and while we've kept the timeline decoupled from the vaccination process, and again, Mr. Smith or Dr. Boyd can check me on this, we have about 65% of our employees have already had their first dose as of today. We registered 90%, and Inova is committed to working with the rest of our staff to be vaccinated in the weeks ahead. Dr. Boyd or Mr. Smith?
I'm just waiting for my camera to come on here. So Dr. Braybrand is correct. When we look at that 65%, we're looking at currently 65% of individuals who have responded to our survey, and we know that more individuals are responding to the survey so that we can have clear data. And once Inova can provide better numbers for us, they're in the process of transitioning to a different system. And once they can provide better numbers for us, we will certainly share that information with the board. We didn't have the ability to separate those individuals out by face-to-face and by virtual. But we, in working with Inova, feel confident that they will be able to provide those first doses within, if not this week, within the next 2 weeks for all of our staff who choose to have the vaccination.
Thank you. On the issue of choosing to have the vaccination, our initial email to staff on January 13th stated, quote, "Receiving the vaccine is a personal choice and FCPS will respect each individual's decision," end quote. Even if that is legally true, I think disincentivizing vaccination is dangerous and should be avoided, at least in the rhetoric that we choose to deploy. What are we doing systematically to encourage vaccination? Isn't it the duty of every person to get the vaccine as medically able when they are allowed?
So I would say that there is a long history and storied history of vaccination in this country, and different people come with different perspectives. And so we wanted to honor those perspectives for those individuals who chose not to, for a variety of reasons, to not be vaccinated. At the same time, all of our information that we've shared with staff has been very positive about getting vaccinations, very encouraging of the process, encouraging of the Inova clinics, their people's abilities to get through in a timely manner. And so we feel that we've been very positive about the overall approach, while at the same time respecting that there are individuals who may choose for very personal reasons to not get the vaccination.
I would contend that we need to be aggressive and have a systemic approach to this. What's being done to encourage staff and monitoring progress about vaccinations at the building level? Are we encouraging principals to be engaged on this front?
So Mr. Frisch, if I was just add in, as Mr. Smith shared, and I'm trying to load my camera, but I don't want to hold up progress here. As Mr. Smith shared, we've been providing updates about the vaccination, certainly being responsive to principal inquiries so that they can support their staff. Principals have supported their staff who needed assistance in registration. And so that system has been very positive. Part of the process for partnering with the health department and Inova was to ensure that it was an easier process for our staff, and so that they received, if you will, special treatment and not having to go through the general process. Certainly we've experienced some hiccups, but we think that special process is indicative that we support staff being vaccinated, but still honoring difference and honoring choice and not wanting to pressure anyone if that's their choice. As of this moment, we have about 3.4% of persons who responded to the FCPS survey who indicated that they do not wish to get the vaccine. And so we certainly respect their positions.
not sure that exactly responds to my question, but I don't want to, use up more time. What's being done to make sure that we aren't like other settings where vaccinations are being adopted disproportionately by race and socioeconomic class? In other words, that our teachers of color or our support personnel are not disproportionately deciding not to be vaccinated.
So, Carl, let me take a swing at saying I think our approach of not making it mandatory has been the winning hand because we did the decision with equity in mind. And so our system is trusting us. I want to find someone with a better registration rate than 90%. I don't know that it's out there. We recognize that it is a emergency authorization of the vaccinations. At this point, the FDA has done it through an emergency process. We're also, as Mr. Smith said, respecting the history of vaccinations in this country. But we believe these trust levels are super high. And I am very hopeful. Of course, some have personal and religious reasons. But I think we're going to get very, very close to maximum percentages of our entire staff actually taking the vaccination when it's all said and done. We have another vaccination that may be coming for approval in just a few days, Johnson & Johnson, that is a one-shot vaccination. And so I think the availability and the ability for folks is just going to continue to increase.
Right. I just want to make sure that we are actually looking for the things that typically keep people from seeking out a vaccine that we see in every other population out there. So if we're not monitoring, to the extent we can, who is receiving the vaccine, we need to figure out a way to encourage populations that historically are distrustful of these kinds of situations. Before my time is up, I do want to get to some questions about the hybrid concurrent model and where we go from here. Eventually we'll be transitioning to 5 days a week of in-person instruction. And I know that this hybrid approach is driven in part by keeping 6 feet of social distancing. Where do we go from here, and how do you see us transitioning to 5 days a week?
So, Mr. Frisch, I would tell you that we are working with the health department on planning for next year. And my goal, I know several board members have asked me, my goal is to open next year with 5 days of in-person instruction. And so we do need to talk about what some additional mitigation strategies are. And I think, of course, reopening school now is going to give us some additional data on our mitigation strategies and what's successful. But we will be bringing you updates around that. We know that's important for you and for the community to know. And Dr. Williams, I just want to bring her voice in the room, may have something either on this or the earlier piece of conversation to share. Dr. Williams?
Yes, thank you. I wanted to speak directly to your point, Mr. Frisch, because I think, the limitation, of course, is individuals' rights to privacy. So the monitoring piece of it can be challenging. But what the research would tell us is that we need to speak directly to those communities that have increased anxieties and fears around vaccinations because of different lived experiences and histories. And one of the ways that we've done that was through our town hall, where we named those issues. We talked about them forthrightly. We talked about what the vaccination was and what it wasn't. And we had plans to continue to talk directly to those populations that we know are less likely to receive the vaccination, because a huge part of that is that people are not talking directly to those communities. So part of our work is to be in communication. So thank you for lifting that up, because it's a very important consideration.
Exactly what I wanted to hear, and I look forward to digging a little deeper on it with you. Thank you.
Thank you, Mr. Frisch. I have on next up, Ms. Omish, followed by Ms. Derenak Kofax.
Thank you, staff, for your hard work on this. And I am, moving in the direction here of supporting this plan. I do have some questions, though. Regarding indoor athletics, I had the chance of reviewing with staff the various numbers per school and just looking at the impacts of that. Have we given any thought into that potentially being, I'm worried about it being a source of a lot of cases that could sabotage this plan, but I just wanted to hear, if there's been thinking around the fact what the numbers show us.
Ms. Omesh, this is such a wonderful question, brilliant question. And I want to be clear today, when we return to school in-person instruction, not athletics, will be the priority. If we find that outbreaks in our athletic program is influencing our operations, then we will pause or suspend our athletic programming so that in-person instruction can continue. That's got to be the focus. Obviously, for the last, well, really, we've been doing athletics since the summer, conditioning. We're going to continue to monitor that data, and our data overall is very good. Much of the athletics is going to transition to our fall sports season, and all of those sports except one, women's volleyball, is an outdoor sport. So we are hopeful that we will have the benefit of outdoor sports and warmer weather, but we will not let athletic issues around COVID-19 impact our classroom in-person operations.
Yeah, what is auditing going to look like for that and actually more generally? Because I know I asked about that before and you all shared that, we were still in the process of training and getting that together. If you could speak to that, please.
Yeah. Do you want
mitigation? Yeah. Go.
Yeah. You want to talk, our school safety teams, or do you want us to talk about our athletic mitigation strategies, or both?
Both, right? So auditing the athletics piece to your point, to make sure that we don't catch ourselves when there's already too many cases that have impacted, our ability to stay open. And then more broadly.
I'm on my phone. Go ahead, Mr. Greenfeld, are you there?
Yeah, I'm gonna do a first crack and then have John Reynolds or Bill Cohen talk about our mitigation strategies. So, Ms. Amish, I think you bring up a great point, and we do have very strict mitigation strategies in our athletics and our upcoming activities protocols. They've been received very well. We have had, as you mentioned, we have had some outbreaks in our athletics. Those have primarily centered around basketball, which is just actually starting to end this week. And now we will have fewer and fewer teams competing as we go on to districts and regionals and states, all coming to an end within the next 2 weeks. The other piece for the mitigation strategies is we will have really the entire month of February and the first week of March to do an evaluation of how those fall sports are doing. And if there are a high number of outbreaks, if you go back, most of the sports that are transitioning back now in the fall, if you go back to the end of the summer and the beginning of the fall, they were all practicing football, field hockey, and we had very, very low transmission rates. So that's a good sign. So I think monitoring that, we monitor that daily. We also monitor that on a weekly basis with the health department. We implement all the mitigation strategies. We are trying to figure out how to get our mitigation teams, as you mentioned, to be able to go and do that. I think the priority is, there's only so many of them. The priority is to get them into schools as soon as kids come back so we can get the board that important data that you've been looking for, that mitigation strategies with students in place in the buildings. And, certainly if capacity allows, we will absolutely have them monitor our athletic programs. I will tell you that Mr. Curran and Mr. Reynolds, both personally, along with some other members of their team, do go around and monitor the activities in the sports and athletics. They've been doing that the entire time. They certainly don't get to every single one, but they definitely are monitoring, and certainly wherever we have any issues, they're going out. So I feel very confident that those mitigation strategies will stay in place and will be robust, and that once we're going to be outside, we're going to return to our numbers that were really outstanding, quite frankly, before we had this spike. And one last comment, our spike in numbers really coincided with the very, very high community transmission. And those numbers have come down drastically since that time. So I feel very strongly about our athletics being able to continue in a positive manner.
Yeah, I mean, I think we have an understanding of the mitigation techniques, but I'm thinking particularly for those teams, as just referred to, right? The audit teams. Is it just, Bill Coran and Mr. Reynolds, or, I mean, we have a massive system. So when it comes to mitigation, not only for athletics, but broadly, where are we with that? The last time I asked, we were still haven't had them trained and ready to go. So are we ready with the audit teams? What does that look like? How regularly are they going to be checking what?
Yeah, Mr. Smith can talk about our safety teams. Mr. Smith?
Yeah, certainly. So our teams are trained, and to date, we've had over 685 observances in our buildings and have shared that information with our administrators. I know there have been questions about whether or not or how valid those safety team audits are without having students in the building, but it's important for us. Well, first of all, we have had students in the building when we did make observations, and it's important for us to ensure that we get these mitigation strategies down prior to. So people wearing masks, people engaging in social distancing, those are all important pieces that we have to have down before students get in. So we're continuing to provide that information back to staff and working with our teams to go out and provide good feedback to our principals and teachers.
Ms. Troutman, was she going to add something? Okay, I guess not. Yeah, I mean, along those lines, I'm thinking two things. One, what happens when a staff member, recognizes that there's not whatever it is, equipment, stuff is not being followed according to expectations. And number two, when they don't have the materials necessary. So I've heard, from some of our support staff concerns about how much cleaning material has been given, if it's realistic. Can someone comment on that? I mean, I'm not asking kind of just in a big picture way, but really being intentional to make sure we're prepared for that, because otherwise this whole thing fails.
So yeah, I'm going to say,
I just wanted to say something real quick, Marty. Ms. Amish, we have personally delivered supplies to the athletic programs specifically so they would have it, and it's outside of even their regular allocation that they've been getting. We meet with, Mr. Cohen has office hours with our DSAs every week. I have attended those. I have not heard a single case of anybody not getting the personal protective equipment or mitigation supplies that they've needed. Not one has come to me that I know about. So, staff has always been encouraged to tell us we have plenty of PPE, and it has been actually personally delivered by Mr. Curran's staff to the schools in their own vehicles. So we are getting it out there. And that's a supplement to what they have in their buildings. So anybody who's listening, I would encourage, if they are short on supplies, please reach out to Mr. Curran or myself, and we will absolutely make sure that they get whatever they need. That will not be, we will not get them what they need, is all I can say. I've not heard that, and we'll double check with them again this week.
And I would add in schools that if there are staff members who are having difficulty, to certainly reach out to their principals. We have more than adequate PPE that we have provided to schools. 200,000 gloves on hand, 66,000 face masks. I could go through a litany of all the PPE that we have on hand and that we've provided to schools. So there are always opportunities for one-offs where an individual may not see or understand where to go, but certainly we always direct staff to work with their program managers if they don't feel that they are being provided for adequately. We also know that certain staff members receive different types of PPE based on the work that they do. And so you may see someone in your building with something that you don't have, and that's another question that you should have with your program manager about that. But we feel like we've done yeoman's work. Our procurement office has done yeoman's work in securing PPE ahead of the game and being able to get that out to our schools in a timely manner and we'll be able to do that continuously as we bring students back to schools.
Yeah, thank you. I mean, even just, I think just being cautious of what we might anticipate, I don't expect that central office will necessarily hear. So the question is, how are we going to be responsive? Like, is there a system where there's a form, a person sustainably? I mean, Mr. Cohen's is available, but in a system of 200, almost 200 buildings, I worry about that a little bit. And even just hearing 66,000 masks, when we're trying to bring back nearly 200,000 individuals into buildings, I don't know. That those are just things that I want to flag for us to think about. Because if we end up with a shortage, then we're not going to be as generous with offering that, and that's where we risk safety. I'm curious about the survey situation. Can you please how families will be able to indicate, what they're comfortable with at this point, given how long it's been since they've initially done that? But I know that's my time.
Thank you. Before we move on to the next board member, which is Dr. Anderson, did staff need to respond any more to Ms. Omish's questions? Okay.
That was a question.
Ms. Omish, why don't you restate the question you feel is still outstanding from being answered? Maybe that'll help.
Yes, please.
Okay, it had to do with survey preferences for families, where we're at with ensuring consistency if families change their preference. Because I've heard, different stories, and I just want to make sure as a system, it's very clear that principals don't have that discretion. Yeah, go ahead.
Yeah, we shared that in a Bray brand briefing, I believe, just a week or two ago. We're going with families reach out to the schools, and as we can on space available, we will make those accommodations. Every school must offer the accommodation if they have the space. So you don't get to pick and choose whether you want to be open or closed for that preference piece, but it is going to be capacity driven for those that had already made the choice, because we're already too far in on staffing and the monitoring to then we would be digging a deeper hole if we tried to make all of the changes now. But where we have the space, we will absolutely provide it for those that want it. And we've targeted right now, and last week, and now we have more in this week, those kids that need it the most for the interventions. We've got them back in for interventions, and we want them in these interventions, of course, to come back and do in-person instruction, of course, in our hybrid model. But some of our kids we know need to be back in person, and we're going to work to prioritize those that have changed their mind from online to in-person to come back.
Great, thank you. I move on to, actually it's Ms. Darren Koufax, then followed by Ms. Anderson, and then followed by Ms. Marin.
Thank you, Ms. McLaughlin. Dr. Braybrand and your team, I do appreciate this thoughtful plan that is before us. And I also appreciate how you have given us time and worked, one-on-one with us, and have also reached out to the stakeholder groups. But I still have several questions. So I am going to, well, first of all, our principals aren't here, but you're saying they're in support of this. They've typically been here, so I would be able to ask them directly. They are all principal association groups are in support of this timeline as stated.
That is correct, Ms. Darren Koufax. It's Francis Ivy. I think Dr. Braybrand is having connectivity problems.
Okay.
We have had multiple conversations with the executive boards at each principal association level, and we have also had debriefing conversations with the whole groups of both secondary and elementary. And the regions have followed up with regional conversations as well. And, and there's an overall positive consensus to the timeline. and adjustments were made and recommendations were made based on that feedback plus feedback from other groups as well.
Thank you, Dr. Ivy. And
I already gave
okay, Dr. Braybrand is getting back online.
No, but she's been out a million times.
Laura Jane, your mic's on.
Yeah, we've got mics going off. Everybody, please check your mics. And
sorry, guys.
That's okay. Ms. Darren Kofax, go ahead and continue.
All right. So I know Dr. Braybrand, you just missed, I asked, and Dr. Ivy answered about the principal's support of this. So we know there's mixed reactions amongst our teacher group because we are getting many, and much of it is around the vaccine and the timeline and how the vaccine impacts. And I do know that that was not part of your mitigation strategy, but I think we have to be real, that we have to understand why that is a consideration, because so I have questions on that. Where are we on the vaccine schedule as to how many want it but did not receive it yet? Are all those vaccines that were canceled getting their opportunities to get their vaccine? I'm talking first round here. And are second doses readily available and being scheduled?
I'm going to take a first crack, and then Marty or Michelle. We registered 90% of folks. The county executive, the health department, and ANOVA have promised us they are going to see us through to make sure all of our folks who want a shot, both doses, can get them. We had a glitch yesterday, but it was an error. ANOVA sent a mistake that they were canceling second doses. I don't even want to say it out loud, but you brought it up, and to be public and transparent. ANOVA walked away and put a new message out today. It was a mistake. They are getting a steady amount of doses each week. The county gets a steady amount each week, and they're committed to getting everybody their first dose, as Marty said, I think over the next week to 10 days. Again, of course, they've got to go and get your second dose after that. We have done our very best. It isn't completely, of course, tied to the calendar. The great many of our teachers will have had both doses, and many will have had both doses and even some additional time after both doses before returning. It's not perfect, though. I'm not going to say to you that everyone will have that. And there really isn't a perfect return to school timeline when we're trying to balance so many competing factors. And that's what's been hard. But I will say this. I am proud of what ANOVA and the Fairfax County Health Department did. They brought us in with open arms, and they've worked through the glitches. We, even during the snow over the weekend, were able to get most of our folks in. Of course, we don't control the vaccination process, and it was never part of the plan, but this has been a super big bonus for us, and I'm really confident that ANOVA is going to have us wrapping up over the next week or two, and we'll keep working on following the science and following the health department recommendations as we keep moving forward.
Thank you. So to follow up on that, can we allow our principals and can we help them? This is kind of an HR question, with flexibility to make decisions by, say, allowing teachers to stay virtually and then until they have received both shots, because many people are given the choice, when they can come back. We are not exactly giving our teachers that choice, or staff that choice, if they haven't received both vaccines. So as part of a caring culture, would that be something you could work out or could make a statement about?
I'm not in a position to say, I'm not in a position to respond to that today. I'd have to reflect on that with my team. We really are trying to balance competing needs here. The challenge is, if the teachers stayed virtual, then the kids would have to stay virtual. So I think that would be quite a challenge. But I will say to you, right now we are trying to get everybody in, and we especially those first groups, have really gotten the great majority of those folks vaccinated with the first dose, and even with the second dose. And I'll be candid, I was in group 3, and I went, and many of the people in line were our teachers coming for groups 1 through 4 back for their second dose. So as Mr. Smith said, we are trying to get some additional numbers from ANOVA, and maybe we can supply them to you. Well, not maybe, we will supply that to you when we have it. But I really think we're doing a very, very good job to get as many people as vaccinated as we can.
Well, I appreciate that. And I would appreciate reflection upon that with your team and maybe this next one as well. I understand that, we are in grades 7 through 12, and maybe I'm misunderstanding this, but because we'll be mixing cohorts, because we have to, that's what happens in those grades. Is this not in the highest risk category for CDC guidelines, right? I mean, it is.
Right. The mixing is one of the things to try to minimize, but it's really not possible. And we're going to have to follow the data, right? We're going to have to follow that data in this model, and we will, about outbreaks. If we see outbreaks coming based on the difference between kids who mix and kids who are just in the cohort, that's something we're going to have to follow the data to then make our operational decisions. That would be an operational decision separate from that health metric, right? That just says, wow, we thought we could mix, but it's not working. And we would bring you those updates.
All right. I think that's important to know. And also, in the meantime, before we get to that point, maybe allowing, I know we don't want it to be punitive, but there has to be some real understanding of guidelines, allowing teachers the flexibility and support in making sure that the kids or the students are following those mitigation strategies.
Yes. Completely agree.
Thank you. Thank you. Ms. McLaughlin, I'd like a go back.
Okay, thank you both so much. Dr. Anderson, followed by Ms. Marin, and then Ms. Rachner.
I'm sorry, Ms. McLaughlin, were you finished?
Oh, yeah, I just thought I gave the cue and passed.
Yeah, I think you're starting to break up. So that's what's happened for me here.
I just keep turning off my microphone. I keep turning off my microphone because I thought you're going to queue up. Are you not hearing me?
I'm ready now. I think I hear you. So I'm going to go ahead and jump in. I do want to say, and I think one of my colleagues shared this earlier, I do want to thank both Drs. Boyd and Dr. Bray-Brand for all of the time that they put forward to ensure that we've built a really good understanding, particularly regarding this decision-making model, which is quite robust, but it has several layers. So thank you for helping me build my knowledge around that. I also want to say that, initially I was one of these people who I also wanted a more aggressive schedule on this. I wanted to see how can we move some of our groups into the building a little bit faster. But I have to say, after this discussion today that spoke to where our grades 3 and 6 are regarding classroom monitoring, I'm really, that's giving me some information to think about. I also want to say this. When Dr. Bray-Brand talked to us initially regarding the two schedules, what he had proposed, and after having those discussions with the principal groups in terms of what they propose, which is essentially what's being provided today, I'm fairly confident that all of the groups, all of the stakeholders who need to make this happen, who are the principals, have been included in the conversation. I'm going to start with one of my questions regarding what information, because I heard from Dr. Bray-Brand and Ms. Denrock-Kofax, let's follow the science. So maybe I missed something. If somebody could just please speak to what has Dr. Adoyensu or any of the literature that you have been reading that speaks to vaccinations being a requirement to returning to in-person instruction. Drs. Boyd and Bray-Brand, if you could speak to any guidance that you've received from Dr. Adoyensu or anyone else around that, I would appreciate it.
Sure, I'm going to defer to Dr. Boyd on that, who's had the most recent and frequent conversations with Dr. Gloria. Dr. Boyd?
Yes, good afternoon. In our discussions with the health department, we have not been advised that vaccinations are required for return to school. However, the health department understands that, certainly there's varying levels of anxiety and that staff would be more comfortable in returning to school. So they really have worked diligently to stand up this vaccination clinic in partnership with the NOVA. We shared our timeline with them. So in essence, they're really working to try to help us to be able to have things in place to support our timeline so the persons are more comfortable. But as we all know, we understand that the process with vaccinations in the last week to 10 days has shifted in terms of how the state is disseminating the vaccination, and the health department's really taking on that ownership. But overall, the short answer is that we have not been advised that they're required, but we certainly understand that it would help with the level of comfort, and to the degree that we can help support our staff and administrators and being more comfortable coming to buildings, we want to do that.
Absolutely. Thank you for that, because I do know it is of great comfort to our teachers and our community, but I also wanted to be sure that we weren't missing some sort of guidance that vaccinations had to be required before we can employ the schedule that Dr. Braybrand has proposed. And I'm hearing that is not the case. So that is also very good. My other question is regarding some of the logistical things as students go back into the school building. Transportation audit. I know that the audit has a transportation component, but is there one that evaluates what happens on the bus, or will there be one?
Mr. Smith, do you want to speak to that?
Yeah, so this topic has come up, and we are having a discussion with our mitigation teams on the possibility of doing this work on buses. We know that we're following a bit of a different set of guidelines on buses because we won't be following fully the 6 feet in all cases. So as we look at that, we can provide more information to the board and to the community about what we're doing on buses.
Thank you. I think that will be an important piece of data to have. I also want to talk about PPE, and I mentioned this to you before, Mr. Smith. We have a large quantity of PPE, and I think in talking with the support staff a couple of weeks ago, maybe it was last week, they did share with me when they have raised the issue with their supervisors, they've been able to procure more. I think I'm starting to hear a little bit of a change in the conversation regarding the quality of PPE. Ms. McLaughlin, do I have time for one more question, or should I just go ahead and be placed in a second turn?
Yes, if they can answer the first question you just posed, I would like to have subsequent questions in your go back.
So what I can share about PPE, and I can certainly let Ms. Burden share more. I referenced earlier we have over 200,000 boxes of gloves with 50 gloves per box. We have certainly enough PPE on hand, and the quality for which we are purchasing is based on health department guidelines. So we want to assure anyone who is listening that we are not using subpar or sub-quality materials when we are purchasing protective equipment for our staff. We are, again, going with the recommendations from the CDC and the health department. I can't be any more clear about that. We certainly wouldn't want to undercut our staff and the safety of our staff and students, and can share that emphatically at this board meeting.
Thank you very much.
Great. Okay, I call on Ms. Marin, followed by Ms. Sizemore-Heiser, followed by Ms. Tolan.
Yeah, thank you. I do want to honor the input from our principals. We have to honor their wisdom and expertise. They're the ones who have been, now I think they've made 3 different schedules. And so I'm really glad that this plan has that support, Dr. Braybrand. I'm very glad to see the intervention cohorts. In speaking with principals, I've heard a variety of ways that principals are using that flexibility. And so I think that that is very much a great strategy to help those students who are struggling mightily during this time. And it offers that local flexibility that I know some were seeking. As I look at the trajectory of information and planning that's evolved over these months, when we really needed to create something entirely new in many places, I think where the plan is now, you know, what I've seen today, it's definitely the most comprehensive version to date. And, you know, while there's no guarantee for anything in life or during a pandemic, I think this is a strong plan with the resources that we have to begin returning to some semblance of what school was like before COVID. Of course, a lot will be different, but I think it's what's needed to particularly help some students recover their learning loss. You know, when we first started, it wasn't at the time we are now. It's been almost a year. So I think this is a strong plan. Dr. Braybrand, I just want to let you know that I do continue to have some constituents asking why schools can't be open 5 days a week to students. So I think that it's important to continue reminding the community that, you know, even though the situation is changing with students returning in groups, if we're going to follow the CDC recommendations, which, you know, some will say, well, they're optional, we need to be really clear as to why we're choosing to do that and, you know, why 5 days is not on the table right now. So those are my thoughts, and I will. Thank you.
Ms. Marin, thank you. We're going to keep working very closely with the health department. We've been following their guidance the whole way, and we'll continue to. And we'll continue to work with them around the goal of 5 days in-person instruction, and look at what additional mitigation strategies that we can put in place. I also think the best thing about this return to school timeline is getting kids back in school and using that data to help guide us for additional mitigation strategies. What's working, what's not. You know, I look forward to presenting more information to you from the health department, but also from our own data so that we can keep working together and get to that goal of 5 days in person.
Thank you.
Thank you, Ms. Marin. We now have Ms. Sizemore-Heiser, followed by Ms. Tolan. And then I have two other board members besides myself and Laura Jane Cohen, who have not spoken yet.
All right, thank you very much. First, I will say I really appreciate all the collaborative and hard work, Dr. Braybrand, that you and your staff have done on getting everybody on board, principals, to, you know, as best as possible in an era where everybody, you know, emotions are high and it's hard to get everybody 100% on board. But the work you guys have done has been exceptional. And I just wanted to first say thank you for that. And I appreciate all your staff and the hard work.
Thank you.
You're welcome. I would like to say that I am one who I have tried throughout my advocacy to center the needs and experience and voices of the students. I started talking about my concerns about student mental health and well-being back last summer. I recognize we obviously need to take care of our teachers and staff and principals and families in order to take care of our students. But I'll be perfectly blunt. I feel like the student experience and voice has gotten out of the center of the conversation, and too often the needs of the adults in the room have centered themselves in this conversation. The thing I hear most often when I mention students is the phrase, students are resilient and will bounce back. And while I agree the students are resilient, at minimum, we cannot have the same, we need to have, the same expectations for our adults that we have for our children. So I'm going to put that out there. And I think it's really important for the public to hear that we have to hold ourselves to the same high standards we're holding our children. Having said that, I would like to mention that my concern for this timeline has always been the student experience, namely that we're, one, bringing our 3rd through 6th graders back just 2 weeks before spring break and our 1st to 2nd graders back 3 weeks before spring break. Dr. Braybrand, I will support you. So I want to lay that very clearly out there. But I also want to mention that from the student experience point of view, I know that teachers talk a lot about taking 2 to 3 weeks to get students in a typical year up to speed on getting used to being in the classroom. This year being a year out of the classrooms, you know, in person, I don't think this timeline does the best by our student experience. I think speeding up, you know, it also, I've heard a lot from teachers and families about childcare concerns about high school students being in, while elementary high school teachers having to teach in the building while students are, their students are at home. So I really think, you know, please consider the student experience and the inconsistency brought on by spring break in this timeline. I think it's really important. So I'm going to put that out there. Like I said, Dr. Bevan, I will support you. I wanted to bring up something that my colleague brought up about secondary mixing. One thing that's really great for me to see since our January meeting are the 2 peer-reviewed studies done by experts at Duke and UNC, as well as by the CDC, that were published in both the American Academy of Pediatrics Journal and the Journal of American Medical Associations that studied in-person schooling at the high school and elementary level, where there was mixing. And both of the studies showed low levels. Familiar with that, Dr. Berbrand? And is that reflective of what you saw in those studies, if you read them?
Yeah, both of those studies are supporting our return to school for all groups. And I do want to be clear, we explicitly talked with Dr. Gloria in the health department about our middle and high school kids and our programs. They understand the full experience of Fairfax is going to different classes. And that's why we're continuing to, collaborate with them. We've continued to emphasize social distancing and giving clear guidelines about hallway use and cafeteria. And we're going to continue to partner with them as we move forward. But they certainly understand that we will have kids mixing in those upper grades. And we'll monitor the data. I mean, the reality is we're going to be able to bring you every month, if not even more often, how it's going as we're returning kids. And that's going to help inform us as we plan for the return to school next year. And we want to return to as near normal a set of conditions as possible. And it will help inform us in these weeks ahead.
I'll need to go back, please.
Absolutely, thank you. Again, I will move on to Ms. Tolan, and then I do have I have Stella Pekarski up next after that.
Okay, thank you. Yes, Dr. Bray and team, thank you for the work and all of the collaboration that went into the development of this timeline. I know you've worked hours and hours. I know many of our students are struggling and need face-to-face learning and socialization. So I will support this timeline and look forward to working with you and your team to implement this and monitor everything as we are, going through this and moving forward. I guess I'm getting repetitive on, what you were just talking about with Ms. Seismer-Heiser, but I feel very strongly about this. That, we would really need to monitor this. We'll need to be flexible and see what happens as we move students in and learn new information. And as we have said, this will help us prepare for our ultimate goal of having students in, 5 days a week, and use this opportunity to monitor what's working, what's not working, to help us get to that goal and figure out what mitigation strategies we will need and how we can be creative and solution oriented to get there. Having said that, I do have a couple of questions. One of the things we talked a little bit about is, and I'm happy to see in the presentation where you're talking about keeping the decision-making to what's happening in each school, where they're going to fit in on that matrix, keeping that at the division level. Can you, and I know in the presentation it talks about, the superintendent designee that will be working on this. Can you give a little bit more background information on, what that situation room, war room, whatever it would be, what is that going to look like?
Sure. We're building the war room as we speak. The war room, first of all, is going to include our region assistant superintendent. They're closest to the region. They have responsibility for those schools, their schools in their region. They'll be able to talk to the principal. We're also creating a data dashboard. Our new CIO, Gotham Sethi, is helping us pull all the data so that the war room folks can look at it on a daily basis and make any operational decisions that we need. So our CIO will be involved, our RAS will be involved, the deputy superintendent, Dr. Ivy, I expect that she will be able to attend. And so we've got some of the core folks on our team, and we're still looking at a few more folks. Someone from OCCR, and I probably am remiss in saying we have our new executive director of our Office of Communications and Community Relations, Ms. Helen Lloyd, with us. And we will have someone, either her or someone on her team, so that we're communicating frequently and quickly with our community in any decisions. Dr. Ivy, did you want to add anything to that response?
I would also say someone from our health team and someone from athletics, so that we can be sure that we're looking at the academic side as well as athletics. We've talked about having meetings twice a day, in the morning and then in the afternoon at an identified time, so that we can look each day, twice a day, at what our data is telling us, and then go from there. And I forgot, we also will need a representative from HR. So it'll be a full team of people from various offices, and the region office would be bringing the information, because they're in close contact with the principal at the school.
Thank you. Thanks for that elaboration. One of the other things I wanted to ask about on the return to school timeline, you've got the dates the students are showing up, and then there's also a column with dates that the teachers are showing up. And we haven't talked about that at all. Can you talk a little bit about, because I see some teachers are being asked to come in a week before their kids, some 2 weeks before their kids. What's the rationale behind that? And especially given, some people are being vaccinated more quickly, some are not. Is there any flexibility in there for teachers to determine how much time they actually need for preparing for the in-person teaching? How flexible can that be? And what's the rationale behind the date?
Sure. You know what? I'm going to actually let Dr. Presidio, do you want to talk a little bit about that in that journey? We had a set date for everybody in an earlier version, and then we went to a more nuanced approach that staggered teacher returns based on the group date returns. But Dr. Presidio, am I missing something?
No, thank you, Dr. Braybrand. And the teacher return date is established 1 week prior to the student's return date for all of the groups, with one exception for group 8 at the secondary level, where because of the grade levels being split over a 2-week period of time coming back, many teachers don't just teach one grade level, they teach multiple grade levels. So that's the reason for that one exception. But the general rule for all the other groups is that teachers will be back 1 week before the students. And the reason for that is, of course, we have some planning and preparation time, getting acclimated to their own classrooms. But we also want to make sure that we have an opportunity to really cover in person with our staff in our buildings, our health and safety mitigation procedures and practices. So it's one thing to talk about it, in theory, in a Blackboard Collaborate room. It's another to actually practice it in the building. And then we also need to make sure that our concurrent technology is set up and working well. So we really do need staff back a few days before students, and that's the reason that we've established the timeline that way.
Ms. Cohen, if I could just add that in speaking to many of our principals at all 3 levels, they're working very closely with staff, and staff who are apprehensive or need a more staggered approach or a more supportive approach in order to come in. We're trying to work closely with them to make sure that they're comfortable wherever possible, but also making sure and balancing that they have the training and time to prep. And so they are trying to provide, we are a caring culture, and they're trying to provide scaffolded supports for those that need it.
Thank you very much. Dr. Presidio, you answered another one of my questions on the, I was going to ask practicing the mitigation measures and just walking through. So I'm glad to hear that that will be happening and that there is that flexibility in working with staff. I appreciate that. One other question I wanted to ask about is I know both parents and staff have asked about, having the sex come in later than high school, that there are some childcare issues. And Dr. Braver, I think you mentioned you had a little information on that.
Yeah, we're addressing that childcare issue. We're absolutely going to take care of those childcare issues over that week or 2 week overlap. And we're going to get some additional information out to our staff about childcare. I don't know if there's anything else to share right now that we have, Dr. Ivy, on that topic, but or Mr. Smith, but we're absolutely going to cover supporting childcare during that 2 week that 2 week interim.
All right, thank you.
Thank you, Ms. Tolan. I now move on to Ms. Pekarsky. And then if Ms. Keys-Gamarra can't join us just yet, I do have Nathan Anabuto who would like to speak. Go ahead, Ms. Pekarsky.
Okay, great. Dr. Braybrand, I really just want to take the time to commend you, to commend the staff. I know you've worked so hard on this plan as well. You know, it's easy, I think, to be on the sidelines and have opinions and ideas. And it's much harder when you're balancing many different factors. I think this past month has really moved us forward. I appreciate you working with us and really spending hours with each board member between meeting with you, meeting with Dr. Boyd, our RAS, to answer our many questions. We're ready. I'm ready. As I had told you, I wish there was some acceleration in certain parts of this, you know, especially groups 1 through 4. But I am ready to support you to be successful. I think, you know, going forward, the data will be imperative, the communication will be imperative, and I hope that what we have done in partnership with you will continue to ensure that we don't only open, but we continue to be safe, stay open, and be successful in our plans ahead. The few questions that I had have actually already been asked. So I'm really looking forward, like Ms. Corbett-Sanders said, to the next thing, which is remediation in fall. So thank you, Dr. Braybrand and staff.
Thank you, Ms. Pekarsky. I really appreciate those words. This team and all of our staff have poured their hearts out to get this right. And we're excited about moving forward to implement this timeline. So thank you so much. It's been great to partner with all of you on the board to get this to where we are today.
All right, thank you for that. Nathan Anabuto, you're up next as our student representative of the school board, and then it'll be Ms. Cohen and myself in the first round. So please go ahead, Nathan.
Thank you so much, Ms. McLaughlin. I'll be brief. I only have one quick point, question that I want to bring up. And I want to thank everyone for all the work that we've been doing. Our teacher pointed out today's been 20 weeks of virtual learning we started. And I think that it's very exciting. And I'm thankful for everyone for getting us to this point and hopeful about the plan that Dr. Brayburn and leadership team has brought forward today. I was just wondering if the leadership team had done any work regarding the feedback from students specifically in the test pilots that we had run way back in the fall into the winter. I was wondering if we had synthesized any information and feedback that they've been given to make sure that the user product is easy and accessible and something worthwhile once we get back into the classroom. I know it's going to be different and we're going to have to learn as we go. So I guess the second part of my question is also, do we have methods of tracking how students are feeling once they're back in the classrooms with this new hybrid model? And do they have like feedback forums and stuff like that to ensure that student voice isn't lost through this like transition period? Because it's going to be difficult.
Yeah, Nathan, always a great question. You know, we've done a lot with you and we should do more as we move forward. And we could bring it to our next RTS work session, some of the feedback from the fall that we did get when we did the pilots, but also talk about how we're going to real time, because the 16th will be just days into secondary students like yourself, about how we'll do it, monitoring it and getting your feedback going forward. So I don't know, Dr. Presidio, if you wanted to add anything right now, but I think that's something we could do at a future presentation and start to share that feedback, both from the fall and what real-time feedback we get as students come back in, and how we're going to track it.
Yeah, I would just very briefly add that we are working to build out some comprehensive plans for how we're going to support students during the initial phase-in period. So basically like the first 30 days when they're back in classrooms, as well as for the remainder of the school year. So we have a cross-departmental team working with region offices and principals on that. And we are looking at a lot of new supports for students, as Nathan suggests, based on a lot of that feedback about making those connections with students, among students, and with teachers again, and what that needs to look like to help students be successful. And we do have some opportunities to get some feedback on how successful that's going to be from our students as well as our teachers. So we'd be happy to share that in a future meeting.
Okay, thank you guys. I really do appreciate that. I would just remind everyone that this has been, as you all know, a really tough couple weeks, past few months for students, and it's going to be really tough as we just adjusted to a new model for those that are returning in person to have to readjust again. So I think tracking how students are doing and seeing what that looks like and how we can help them and best support them throughout that transition and into the rest of the school year will be really helpful and will be really appreciated. So I appreciate that.
Thank you, Nathan. Always great to hear your student perspective. So at this point, I turn to my partner, Laura Jane Cohen. You're up next. I will then take my turn, and then we will proceed with go backs.
I see Dr. Williams had her hand up to respond to Nathan. Can we give her a minute to do that?
Thank you so much. I just wanted to briefly say that the equity department meets with the student equity leads on a regular basis. And so that'll be another way that we'll be getting feedback about the challenges that students may be having as we make the transition back to in-person instruction. So thanks for the question.
Thank you, Dr. Williams. I was grateful to hear your response to Elaine about giving principals flexibility and encouraging them to have flexibility. You know, I'm still hearing from teacher after teacher who has not only not gotten their first dose, but they haven't even gotten the reschedule, notification after it was canceled. So, I think particularly when we look at some of our specialists who are definitely going to be some of the folks who are exposed to the largest number of people, I just really encourage whatever we can do to help support them. And in the vein of helping support all of our teachers, I understand that this train is moving. What I would encourage then is what can we do to give comfort to our staffers? So, one thing I think as a system, we got to be prepared. If teachers are going to start putting in leave because they have another week until they're fully vaccinated, how are we going to deal with that?
No, that's a fair question. And, that's a fair question. And I'll work with staff and have an appropriate response for that. But yes, that is something we'll have to be prepared for. As I mentioned, we do have the volunteer program that we're pulling with all our central office people. And so we will deploy those on a temporary basis, especially here at the beginning and for any situation, including ones you've described.
And I would just encourage anybody from central office, if you haven't explored the system to be able to volunteer to be a monitor. It even allows you to pick specific days. It allows you to pick specific schools. It allows you to pick specific types of schools. So my number one concern is when we talk to our principals, that if you still have to quarantine, even if you've been fully vaccinated, being able to have a body in the classroom to meet kids there is going to be incredibly difficult to do consistently unless all of us step up to be there. So I would just encourage, please do that. The other thing I would ask you, and I know I keep asking about this, but the availability of KN95s. I know that we didn't have the health department available today, but I know that you all have been trying to get more information. Is there any update on that?
Dr. Boyd, do we have anything on that to share?
We don't have any updates specific to the KN95, Ms. Khan, but we're going to be following up on that. But we have been monitoring the CDC website, and there are some updates with regard to masks there, and we're updating our guidance in accordance with the updated information there, just in terms of the types of masks that are recommended, and we're providing those updates to schools to share with families.
And I can add a little bit more. What we do know about KN95 is that, like N95, there's a certification process with those. And so while people might be using KN95 masks for personal reasons, if you're going to use them within the workplace, there's also a certification of fit process that has to occur. And so as part of our follow-up, we'll look at that and have further conversations with the health department.
Right. I would just say again that the KN95s, though, don't have a fit process. So, that's one different layer than an N95, but between the cloth. So just hoping that we can encourage that. The next thing that I was going to ask, I look at my schools and the data that was provided by our RASs, which is super appreciated, of the mitigation reports back. I have a lot of schools that are in the yellow. And even as a board member and as a parent, I can't look at that and know, did my school, are they yellow because they didn't put stickers on the floors yet because they know that the buffer is going to pull them up and so they're waiting to get the timeline? Or is it because they're walking around and seeing a ton of staff members without masks? So I want to ask, is that mitigation information going to be publicly available so that staff and families can see it?
We're currently working on that data internally and recognize that individuals will want to see that. I know that we want to make sure that we're providing as consistent feedback to schools as possible so that we don't have outliers based on some of the feedback that we're providing. So we're having discussions about that and are working toward a time frame where we would be able to provide that information for each school. But we don't want to get ahead of ourselves until we make sure that the information that we're providing principals is good. And then also checking to see if we have to make any adjustments once students get back into buildings.
Ms. McLaughlin, would you kindly put me down for a go back? I've got more to ask.
Absolutely. Happy to do that. I will go ahead and take my turn. So first of all, right out of the gate, I have shared with vast majority of the colleagues and Dr. Braybrand that I absolutely support getting our children in as soon as possible. My one concern has to do with the timeline for our grades first, second, and then the second grouping, third through sixth. So Dr. Braybrand, my first question is, did you survey all 150 of your elementary school principals in terms of understanding that they wanted a 2-week gap between the kindergarten transition to grades first and second?
Dr. Ivy, can you talk a little bit about the work with the associations directly? I don't recall I don't recall the survey piece. I know the executive board of our elementary folks had a unanimous vote to support the timeline. Dr. Ivy? Francis, are you there or can you hear me? Well, maybe I might have to just check on Dr. Ivy. I know we worked with all the principal associations. I don't know if the survey went to all 120. I do know. Okay, she's frozen, going to try to log back in. I know that the executive board, 23 strong, that represents all the elementary association folks. They're divvied up by region and groups. It was a 23-0 vote to support this timeline. 23-0, which is unheard of in voting, really from any group of that size. So very, very pleased with that. And Dr. Ivy might have a little bit more. She's going to try to log back in here in a minute. We can get back to it if you need more info.
Yeah, the second question I have is, what other school divisions do you know, locally, statewide, or nationally, that are instituting a 2-week transition gap between their kindergartners and the rollout of their other elementary students? Just for kindergarten only.
I don't have that off the top of my head. Lots of groups are staggering groups of kids back in, but I don't know about
I appreciate that.
off the top of my head.
Yeah, no, that's the reason I ask is just our neighbor right down the road, Loudoun County, their plan is to have kindergarten through 5th grade all come in together starting February 16th. And so, my heartburn is that we're going to tell Fairfax County families that we're not capable of bringing our 3rd through 6th graders in until a month later, and to the point that Ms. Eisner-Heiser made about spring break. So, but I will also say to my colleagues who the conversation was about classroom monitors for grades 3 through 6, and even grades 1 through 2nd grade. Let's keep in mind that we have 150 elementary schools. So 94 monitors is less than 1 monitor per school. I know it doesn't break out evenly that way, but Dr. Braybrand, as you know, I've always said you can't keep a whole school system shut down because you have some pockets and holes. So data and context really hasn't been presented here about how those monitors that we still need, the 94 out of, I think it was 202, but that doesn't say how many total instructional employees we have. And I'm trying to put the numbers into perspective because, as you said earlier, we've made great progress with our monitors. And so, we're really a month from now where we're going to be, there is no reason to believe we couldn't have moved this up by simply 1 week. And that, to my colleagues, it's not about disrespecting our principal association, whether it was 23 of them or whether it was 150 of them. But I wanted to see the data that demonstrates the need for transitioning simply kindergartners who, based on class size and based on the numbers and how we bring them in, you're talking about 5 to 7 kids per class with a teacher and an instructional aide. I deeply respect our hardworking educators, staff, but our middle school and our shut up.
Yeah, I heard you, Megan. 2 things I want to share, and I can get an update for the next meeting.
Sorry, Dr. Braybrand. I just want to finish my sentence, but my screen went black. The fact that our middle school and high school principals and their teams are standing up and getting far larger populations ready to go by March 2nd, as you know, that's why I just really wish we were doing that at the elementary school level.
Right.
So I was finishing my sentence.
Yeah, and one thing you said about data and context, and I'll work with Marty and Sean, our ADA accommodations are far higher, the number of teachers that we have been able to serve than surrounding jurisdictions. Nobody that I know of has reached out to provide as much accommodation as we have for our staff. And we can get you some of those comparisons as possible. And the other, and Mr. Plattenberg, let me see if Mr. Plattenberg is on. And I don't see him on. So I will, oh, yeah, he is. I do believe the footprint for our elementary schools is larger than many of our surrounding divisions that really have a much smaller elementary footprint than we do. And Mr. Plattenberg, can you speak a little bit to that? But I could be wrong, and I stand corrected if I need to be corrected.
Yeah, can you hear me?
Yeah.
Okay, I mean, that really isn't necessarily the case due to some of our older facilities that really were designed as in neighborhood community schools. And we've put additions onto them, but they started out as, for example, the standard average elementary school for Loudoun prior to them going to the vertical elementary was 109,000 square feet, and the older elementaries were about 60,000 square feet for Fairfax County. So even though we've put additions onto them and they're larger, we do have some that are rather large that accommodate up to, our standard now is 875, students at the elementary level. But we do have some of the older chassis that are, we have a lot more than anybody else too. So when you have, close to 150 elementary schools, when you look at the total volume of square foot, we've got quite a bit in comparison to anybody else. But the individual school size, the other school jurisdictions, their new ones are about the same size as ours. And yet we do have some older chassis that we haven't built additions on that don't quite come to that. That might be around 80 to 90,000 square feet now.
Okay, Jeff, thanks. So facilities maybe not as much a distinction as our HR piece, and I'll get you the updated data around that in comparison, Ms. McLaughlin, shortly.
Great, thank you, Dr. Braybrand. All right, so colleagues, at this point it's 3:40. It took us almost an hour and a half to get through the 12 of us in one turn, and actually only 11 out of the 12. At this point, though, I would like to honor go backs, and we'll go with 90-second go backs, and then take a time check at that point for wrapping up the work session that's supposed to be done at 4 p.m. For any school board colleagues that need to leave sooner, please send me a text message and I'll move you up in the queue. But otherwise, staff, thank you for your input, but board members, I hope we'll just use this time to talk with each other about where we are in anticipation of Thursday night's vote. So thank you. I'm going to start from the top, and that's with Ms. Karen Corbett-Sanders.
Thank you. Couple of things. One, I support this plan. I agree that I would love to have it accelerated for our younger learners, but given the information you provided, I understand, and I just think we need to move forward. I have 3 questions. One is on the transportation audits. What can we do to make sure that we're doing that more consistently? And what is our plan? The second part of it is, what is our plan if we have a shortage of driving staff? And are we doing anything to work with our community to have our community drive our students to school that can? And then the last piece is the graduation class of 2021 is coming quickly. And I would like to see a plan that's consistent across the county as to how we are going to celebrate and honor the class of 2021 in their graduations. So those are the 2 areas, transportation and graduations.
So, Dr. Braybrand, back, I can address the class of 21.
Great.
We will be standing up a group to work on graduation. And definitely we learned a lot of lessons from last year that we will apply, for this upcoming graduation. We currently are working on some plans as far as activities leading up to graduation, beginning as early as February, and what we can do to honor the class of 21 and bring them closer together. And so we'll be sharing more information about that, but we recognize that graduation is fast approaching, and we look forward to bringing plans well in advance so everyone knows what we're going to do.
Thank you. And the transportation piece, I see Mr. Plattenberg. Can he answer these questions?
Yeah, I'd be happy to, Ms. Corbett-Sanders. Could you clarify your meaning of the audit?
The safety teams have been very deliberate in going through our schools and making sure that they provide feedback so that we can address concerns on the mitigation factors. But we also have the transportation piece, and we know that the students are going to be less than 6 feet apart. So those mitigation factors become that much more important. And so having the safety teams review them, periodically check in on how that transportation is working and getting it back, as well as, just because I'm clarifying, as well as how we address it if we have multiple bus drivers or aides out on their buses? How do we make sure our buses can keep running?
Absolutely, and those are two very good questions. In fact, the first one, there's been recommendation. I know CSAC had provided some information that we forwarded to the team that's providing the review. I know that they did address and speak to transportation in terms of if when the mitigation teams are there on the early mornings or in the afternoons when drop-off and pickup are occurring, for them to include that in their evaluation report. We have provided additional information because there was a lot of other categories that were recommended for consideration out of CSAC. And I do know that we're going to be constantly monitoring and taking a look at how the mitigation teams are working with that. And, you know, I think maybe Mr. Smith might want to speak a little more to that in a minute, just as the overall teams. But, and then the other thing, we are monitoring the number of drivers in attendance. We have done surveys with them. It is a concern. We as you know, and have mentioned before, you know, we've had a shortage of drivers in attendance, and there's a national shortage, but our concerns are around that as well. And that is one of the important drivers that we had reported on early on with HR in terms of being able to stand up, and when things turn into amber or red, in terms of being able to, the continuation is the employee pool, basically, if you will. So we are in communication with our drivers. We do know that we're going to be taking a look at that. The fact that when you look at the phasing in, the timeline that Dr. Braybrand provided, we will be able to go ahead and monitor and report out rather quickly to the war room that he spoke of. One of those mitigation elements that we'll be taking a look at is the employee pool and the ability to staff. And it does come down to not only that, transportation, but also custodians and, you know, monitors and the like. So very good questions, and we're going to continue to monitor and report out on that. We do have supervisors that can fill in, and I think Mr. Smith was going to add a little bit more to the survey teams, safety teams.
Well, I was simply going to add that our bus drivers have been trained in the cleaning procedures for cleaning their buses, and we can certainly provide some guidance around face masks and the respiratory etiquette. I shared earlier that the social distancing will be a piece that we have to look at because we know that students will be closer together than that 6 feet while on the buses. But again, we will certainly be able to provide some guidance, and the transportation folks have reached out to our safety teams, and we are working with them.
I'd just say it's a good place to partner with our community to ask for their help in driving their kids to school. Thanks.
Great. We move on to Ms. Omish, followed by Ms. Dernek Kofax.
Thank you. Picking up right where I left off, as I wanted to ask, you know, if we don't have enough building capacity in certain areas, and as we get closer and closer to just finally opening once and for all, what happens when families want to switch preferences?
Ms. Omesh, if families want to switch preferences, we've encouraged them, and we'll continue to communicate. Reach out to the principal, have the conversation, look at the classes or the grade levels, and where there's space, we're going to accommodate it. And so we'll make sure that's clear to communities across all of our divisions, and that it's in multiple languages, and that we're working with parent liaisons to make sure that information's there. One of the other things I think we're really going to take a look at as we do these interventions, you know, we're finishing up looking at second quarter data, is where we really need to reach out to families and say, hey, what's working for you, what's not? Even as you're coming back in person, are there some kids out there virtually who maybe they really should come in? Now, we're going to respect family, you know, decisions, but are there kids that we really want to encourage at least to come in and try an intervention, and then maybe later who might be reluctant to come back full force, but trying to do everything we can to get them to step their toes back into the school and get a comfort level, because we know this is disproportionately impact many members of our community differently, our communities of color, And some of our communities, as we look at school districts across the country, are still reluctant to want to return in person. So we're going to need to be proactive about inviting them back in, or opportunities to get more comfortable. They're not ready to make the full decision, but could they come back for an intervention? Could they come back for an after-school activity? And if they're more comfortable later in this year, to decide to come back in, with us full time.
Yeah, and I think we just need to anticipate the potential issues with that, like if there's a school that has room and a school that doesn't, and they're nearby and the kid wants to go back, but their school is full, et cetera.
The honest truth, if I could be as candid, which I know you like, all of our energy, or a lot of our energy, has been around the planning for RTS, and what you're doing now is shifting accurately. Now we got to put our energy and time in implementing this well. It's not just having the plan. Now the name of the game here is going to be effective implementation of this plan, and doing it well, and keeping the board and community and our families and kids updated. So that's our plan.
Yeah, proactively anticipating what's inevitably going to come to be a problem, right?
Right.
The other thing, could you comment a little bit more on school by school response, how that's going to work, depending on what happens, given that COVID is so different depending on where you are in the county?
Well, I want to be sure to be clear that the decisions around schools opening and closing are going to be division decisions. We'll have school data, but it's going to be made by that core war room team that will be division level. We will not have individual principals making decisions about the closure or opening of individual schools.
But the possibility of certain schools being open and certain ones not exists, right?
It does exist. We're hopeful. We've got to see the numbers keep coming down. And as Dr. Boyd shared, from all of our data from the summer up until now in schools, including in the fall when we had kids, we didn't have a school that triggered that 2 outbreak. I think Dr. Boyd, correct me. We had no schools that had 2 outbreaks within 14 days that would have been a medium impact. Is that correct, Dr. Boyd?
Yes, sir.
So we were low. We were low, and now we're going to have the advantage of the community numbers coming down, and many of our staff, large numbers, we estimate, again, 90% being vaccinated. And a lot of that FCPS by the numbers data was staff to staff. Student to student or staff to student remains very, very low. So those are promising, but like you said, bring me the data. Bring me the data to see it, and that's how we're going to help build confidence as we bring this plan around along week by week and month by month with the updates. Is sharing the data with the community, and that will help us.
Yeah, I think there are an infinite number of unanticipated consequences I can think of related to that possibility. So troubleshooting again in advance is going to be critical. The last question I have, actually, I'm going to share something real quick to illustrate my question, just to make this easier for everyone. I'm not meaning this in any direction towards advocacy. I just want to make sense of the thinking around these pieces. If you could help me understand as we move into hopefully moving this plan along, the timing, I think, in what the thinking was in terms of how to segment these groups would be really helpful, just given the inconsistency, I guess, that's there.
Yeah, Abrar, what I would say the most honest answer is our planning never had the vaccination timeline in it. It was always decoupled. As you've seen, that vaccination process has had more twists and turns than an Agatha Christie novel. We tried to do everything we could to be inclusive and get ANOVA to work with us. And I think we've done a pretty good job. But we did not build that timeline around what you put here, which is the second dose plus up to 2 weeks more. We just didn't. It wasn't part of the CDC guidance or Virginia Department of Health guidance or the local health department guidance. At the same time, we aggressively took this opportunity with the vaccination process to get placed in that 1B and to get as many people vaccinated as possible. And I do think most of our employees will have had the second dose and will be well on their way to that additional time. But it isn't everybody, and and it wasn't built with that as the goal.
Appreciate the honesty. I know my time is up. Just to clarify, I made this chart. It wasn't something that was posted or anything. Just for my own sense.
Very good. No, it's very good.
Thank you.
Okay, going with the first queue, I do have Mr. Frisch, who did not have his go back turn. So then it'll be Ms. Dearnett-Koufax after that.
Thank you. I want to return to the question of 5 days a week instruction if we can. Dr. Braybrand, are you far enough in the thinking around the transition to 5 days a week that you can address the possibility of priority populations like students with special needs getting expedited access as we work to stand it up for all students?
Mr. Frisch, I'd be much better prepared to want to have that conversation at our March meeting than today to really have everything down, because if I answered, I wanted to have enough follow. I haven't done enough to be ready. It's not board ready, and I don't want to disappoint. So I need a little bit more time, but I will do everything I can to talk more about what we would be looking at for the summer. For the return. I do want to say part of what I think that will be, though, is looking at how we do in these weeks ahead in February, March, and April. So I may have something to share in March, but I may not have the entire piece, because I want some of it to be informed by our own data, not just other districts' data, not just, I want to have our reality as part of the final guidance.
Right. I think it speaks to the question that we just had, right? Of now that we're moving forward, how do we do it well? And then what comes next? On that end, on mitigation, how are we making sure that staff have a way to report mitigation issues anonymously? I've heard from several people on staff, teachers and others, who worry about being seen as rocking the boat.
So we've provided staff the opportunity to share that information through our Ombudsman's office. And so if there are issues that they're seeing around mitigation issues, they certainly have the ability to use that venue to then have the Ombudsman share information with the appropriate staff members.
How regularly are we reminding staff that this is an option for them?
I don't have the answer to that, but we can certainly follow up so that people feel that they're empowered to share information if they feel that things aren't going well within their building.
And then finally, how will that information be shared with the board about those anonymous tips, as it were?
Well, if the board would like to hear about them, we can certainly provide input to the board regarding the tips that are coming in. So any way that the board feels it wants to be informed, we can certainly share that through the Braybrand briefing or through other means.
Mr. Frisch, I think we could work with Armando in the Ombudsman office and have a regular report instead of waiting quarterly, given that this is the RTS time. And
even if it's not prepared for the presentations as like an attachment or something.
Yeah, right.
On the question of learning loss in summer, do we anticipate that the offerings this summer will be concurrent hybrids like we're moving into?
Sloan, do you want to answer that?
Yeah, again, obviously, we're a number of months out, but we're hoping to be in person for summer programs. We are planning that we might have to be hybrid environment, but we're hoping to be in person as much as possible with small groups of students. So that's our goal that we're working towards, but of course will depend on the health conditions and the guidance from the health department.
And then my final question, I'm very excited that we've asked central office to sign up to support as classroom monitors. How many people have taken the opportunity to sign up, and how is that going? Look at that, right on the bell.
Mr. Frisch, that's a great question. We've only had the registration process open for a little bit over a week, but we have about 100 people who have signed up thus far.
That's great.
We're continuing to work on that, but we really, really appreciate those folks who are interested in doing it, because obviously they have important jobs to do as well, but they're interested in doing anything possible to support our schools. So
that's awesome. Thank you.
Thank you, Mr. Frisch. Ms. Derenak-Kovacs, please indulge patients just a little bit further. Our colleague, Ms. Keys-Gamarra, who is working with some family issues that are very important, has been able to join us. So I'd like to invite her to have her first turn, if that's okay. So Ms. Keys-Gamarra, please go ahead.
I will be brief. I'm trying not to repeat things that may have been said. I appreciate everybody's patience. So I'm going to center my questions around communications, Dr. Bray-Brand. I do appreciate the proposal that is being put forward. I would say, if I had my druthers, as my grandmother would say, I would certainly have the older kids going back before some of the younger ones, so we don't create some of those problems in terms of childcare for many families. But I think we're a little past that now. So I think with respect to communications, the community, we would really benefit by helping the community to understand how they will be informed going forward. I am pleased to hear us talking about a 5-day plan as well as a summer plan. And can we count on perhaps having a fuller explanation of that at this March meeting?
Yes, on the March meeting, a fuller explanation, maybe not everything yet, but fuller. And we'll certainly communicate. Again, there was some discussion about the board today about what you all may choose to want to communicate Thursday night. But we're going to communicate with our folks, our community. We have been, and we will weekly, including later this week and early next week as well, around all of our return to school plans.
Okay. And I'm hoping that, and I think I heard Dr. Ivy mention senior activities, high school seniors activities, and perhaps additional information at that time. But if there's any way that can be expanded to include all of our high schoolers who, I think the social emotional piece needs that significant support. But I will tell you, Dr. Bray-Brand, but I've had some communications from people who wanted a report on possible in-person by April. I suggested that might be too soon, but I think if we can state clearly how we're going to communicate this, it might be helpful.
Well, I mean, I don't want to presuppose the board. If the board is ready to provide consensus today, I will communicate that to our division tomorrow and the day after. If the board feels that's not acceptable, then we'll have to figure out an additional way. But people are ready to know if this plan is a go. And so either consensus today or something more formal later this week. And I'm prepared to accept either way from this board at any moment.
Well, I certainly support moving forward, Dr. Bray-Brand. I think we have to get our kids in schools. I've heard from our principals that they really want to at least have this opportunity to work out some of the things that will help them move forward in the summer and in the fall. So I'm in full support, even though I may have had some other suggestions, but we have to move forward. So thank you for that opportunity, and I appreciate the patience of my colleagues.
Thank you, Ms. Keys-Gamarra, and thank you for the grace of your colleagues. I know, again, this is not a perfect plan. There's things in this plan that many of you have shared honestly with me, one-on-one and now publicly. But being able to unify as much as possible around this plan, I think, does send a strong statement to our community and to our staff. So I do thank you for your comments.
Great. Thank you, Ms. Keys-Gamarra. Ms. Derenak-Kovacs, you get to finally have your go back. Please proceed.
Thank you, Ms. McLaughlin. Dr. Bray-Brand, just following up one of my initial questions to you, And then also it was supported by Ms. Tolan and Ms. Cohen about allowing principals flexibility. Would you be able to comment on that? Would you be able to confer with your staff by Thursday to see what that might look like?
By Thursday, I'll do my best. I'll do my best, and I will do my very best. That's my that's my answer.
I think that would put at ease a lot of my constituents who are teachers, and I think would help me in my decision making with this plan, because I do think it's a good plan, and I do think I understand that the people that are ready to go back are ready to go back. I think it's really interesting, though, when I look at my data in Region 3, I noticed that there was a nearly 50-50 split between those families who wanted to come back virtually and wanted to stay in person. Not in every school, but when you look at it at an aggregate. Do you have data, and could you provide this to us also by Thursday on this on a system-wide basis and break it down by race?
Woo! Yeah.
Dr. Brabrand, we actually have that data.
Okay.
And, based on a conversation that Ms. Fairfax had with Dr. King, and Dr. King has been working with Dr. Presidio and others, and they just sent us that data while we were here in this meeting today. So we need to review it, but I think we can provide that.
That would be wonderful.
Tammy, I'm sure we can do number 2 now. Number 1, I got to be honest, I have got to reflect on that. We've tried to build in a lot of flexibility, of course, through our ADA process, 3,000 plus teachers. I don't want to make a promise I can't keep to you. You know, I respect you too much and your leadership and your advocacy. And I know what you're advocating for, but I don't want to promise something I can't deliver. But I'll certainly review it.
I know, and you're being honest, and I'll be honest. Of course, it wasn't ever part of our strategy to come back, but it is here now, and it is definitely under consideration by those, and you know that. So that's why I asked that.
Okay.
So I couldn't end a return to the school session without asking about actually. I've said this to you privately, that the CDC and President Biden have talked about the proactive testing. I ask you now, could CARES money be used for this? I know it is not necessarily in the plan that the county has asked, but it would be another factor that would provide confidence for those people that are nervous about coming back, both students and faculty.
Yeah, and Dr. Boyd, there was talk about a pilot, correct? And we could look at some CARES dollars, and it looks like the Biden administration and the Stimulus 3 may have testing. So when that happens, which could be another few weeks from now, we may be able to, as we're returning to school, to look at that. I don't know, Dr. Boyd, do we have any other updates about the one pilot that we were looking at?
No, there hasn't been any updates from the health department regarding their potential pilot at this time.
Okay. We'll have an update, Tammy. We'll have an update for our March meeting.
Right. I'm just trying to add confidence measures for many people.
Sure.
Thank you.
You're welcome.
Thank you, Ms. Derenak Kofax. I'm going to move on to Dr. Anderson, followed by Rachna Sizemore-Heiser, and then Elaine Tullen.
Thank you. I have a quick question and then I guess an ask of you, Ms. McLaughlin, as the meeting manager. My first question is to probably Mr. McDonald in HR. We've been asked this quite a bit, at least I've been asked this quite a bit, and I don't know how to respond to constituents who are asking if teachers are availing themselves of the vaccination, what impact does that have on ADA accommodations? Can you speak to that, please, someone?
Sure. So right now, individuals that do elect to receive the vaccination, if they wish to withdraw their ADA accommodation, they should contact our Office of Equity and Employee Relations. We're hearing from principals that a great number of folks that once they do get their vaccination, will be very happy to return to help support the in-person instruction.
Okay, thank you. So it's not considered an accommodation, it's still personal choice, correct?
That's correct, yes.
Okay, thank you. The second piece that I wanted to raise is, in the conversations today, it appears as if most of my colleagues rather, have stated that they would be in support of Dr. Brayburn's plan. I would like to ask the meeting manager to perhaps lead us into a consensus around that so that they can begin to plan and kind of move ahead. I'm not seeing a great need to move this off until Thursday. Ms. McLaughlin?
Yeah, Dr. Anderson, I'm just pulling up my camera. So in terms of what you're proposing, I know we had said to board and our leadership team and the public that we would not take any votes today. However, I do think in light of how the board is speaking, and as Dr. Brayburn said, the strong benefit this brings to our entire community stakeholders, I support that after everyone's had their second go back, that we will go ahead and just take a consensus of the board and support for the superintendent's timeline. And then as you and I discussed, both Laura Jane and I will confer with you as chair and vice chair on just reporting out to the public on Thursday. I think it's extremely important that the board holds the ultimate authority on closing and opening schools. And so I'd like to make sure that our Thursday public meeting, the public hears from the board itself. And I know Dr. Braybrand certainly can speak well to it, but we should have our voices as well.
Thank you so much for accommodating that request. That will be it for me at this point.
Great, thank you, Dr. Anderson. So at this point, I will go to Ms. Sizemore-Heiser, Ms. Tolan, and then Ms. Pekarsky, and then wrapping up with the two meeting managers, Laura Jane and myself.
Great, thank you, I appreciate it. And since I made my advocacy statement earlier, I'm going to turn to some of the questions I had. First, as we're switching, to in-person learning or starting it up, we'll obviously be doing more concurrent learning as well. I'm curious, our teachers have been working really hard this last year and a half, on virtual learning and sort of learning a new way of teaching. What supports have we given to our teachers and also our students to prepare them for concurrent teaching and concurrent learning?
Dr. Presidio, would you like to speak to that?
Sure. I think, there's a lot of different things we've done from multiple standpoints, but we've provided a lot of professional development guidance for teachers to prepare for concurrent instruction. We're trying to provide them, obviously, with some additional planning time so that they can get ready for that challenge. We've provided them with resources and materials. And part of what we'll be doing, of course, with students, and you're always a great advocate for, how are we educating our students around some of these challenges as well. Part of what we'll be doing when students first transition back into the classroom, we'll focus on being successful in a concurrent environment as well. So not just how to collaborate with, peers in the classroom, but opportunities to continue to collaborate with peers in that virtual space as well. So.
Great, thank you. I appreciate that. And that kind of leads to my next question is that there are, quite a few students who are going to remain all virtual, as we see from what are we doing to help them, prepare for concurrent learning? Because it is going to be different, and there's going to be questions on engagement and student mental health. So do we have plans specifically for our virtual only students?
Well, again, we have, updated resources. Like I mentioned, I think part of the challenge is going to be figuring out how we keep virtual students engaged, just like it's been throughout, the first 2 quarters of the school year. So, continuing to look for some of those additional opportunities outside of the regular classroom instruction to build connections with their peers and their classmates is going to be critical. Again, looking at those opportunities for, extracurricular types of activities, clubs, things like that outside of the regular school day, we think is going to be really important.
I think, Dr. Presidio, you're reading my mind, because that was actually my next question, which was about not losing sight of the importance as we're returning to school. I know a lot of our interventions have been based on grades, but on not just social and mental health, but that importance of connection and belonging, and giving our students ways to re-engage with their schools and their school communities, whether it's through extracurricular activities or just ways to reconnect with their peers and teachers. But so I want to make sure that that was intentional parts of our return to school plans. But I do want to just put out there that I am concerned about our teachers are exhausted, our principals are exhausted, our students are exhausted, that we make this switch to concurrent learning as easy and supportive as possible for all of them. If you could just address the extracurriculars, I'd appreciate it.
Well, I mean, I think, what I would say is those continue to be an area that we need to build out with more intentionality. And, we're working very hard to do that. Dr. Ivy's been leading some efforts around increased access for community use groups as well to do some things with students. So, it's an area that we've done some things and we know that we need to continue to do more. And that is part of the plans that we're working on with schools as we re-engage students in in-person learning, think about concurrent, and think about those students who are going to remain in virtual is, not again, just that focus on academics, but the real need and focus for social emotional connections for students, both in the classroom and outside. And we know extracurriculars are a huge motivation and connector for many of our students. So we're going to continue to, really work on amplifying those opportunities for our students.
Thank you very much.
Thank you, Dr. Presidio and Ms. Sizemore-Heiser. Okay, we're going with Ms. Tolan, Ms. Pekarski, and then Laura Jane and
Yes, I wanted to just go through example XYZ middle school, just to make sure that I understand, and I'm sure XYZ middle school, high school would probably be the same, how the metrics work. So maybe Dr. Boyd, you can help me with this. I'm looking at slide 17 from the presentation. So it says that, and I understand how this would work. Like if you're deciding, is the school opening? Are we putting in groups, 7, and are we putting in groups 8? I'm sorry. So let's say that they're in, group 8 is in. Okay, so we've got, this, all these students in the middle school. And we have 2 small outbreaks within 14 days. That puts us in that only the priority learners should be in school. So then does that mean at that point in time, our large numbers of our students in 7th and 8th grade, in the case of the middle school, they would then go to virtual learning? And if so, when do we decide to bring them back? I just want to make sure I'm understanding.
Yes, thank you, Ms. Tolan. Great question. So what you've described is correct. In the case where all students were in school, and the school fell within this highest community transmission medium impact, that only those priority learners would be in school. And if it were, as in this case, as a result of an outbreak, that those students will be returned as soon as we, as we work with the health department to ensure that the outbreak is resolved, and with whatever the challenges were that were identified in the contact tracing and contact investigation process, that we've remedied those things. So if there was issues with social distancing, that we're working with that school to make sure the desks are appropriately social distance, or if it was traced back to something that was happening in the cafeteria, how we could maybe how we would put some additional mitigation factors. But our desire and our commitment would be to return those students as quickly as possible, but just needing to do that temporary pause to address that challenge with respect to the outbreak.
Great. So that is the situation. That whole thing would go through that, the war room, as we were talking about earlier, where at the district level, there would be this decision that that's where we are. At this point, we're pausing our 7th and 8th graders that are not in group 1 through 6. And then that group will decide when they come back, and we'll be in contact with parents as we go along.
Correct. Yes. Yes, ma'am.
Thank you for the clarification.
Thank you, Ms. Tolan. Ms. Pekarski, you are. Ms. Pekarsky, do we have you here? You're showing up on the system.
Yeah, I'm here. I apologize. I couldn't hear you. Actually, just very quickly, and Ms. Sizemore-Heiser already kind of touched upon this. So just Dr. Braybrand, I'm still getting questions about extracurriculars, you know, what we're allowing, what we're not allowing. Have we been able to update our website just to have the most up-to-date information accessible so our parents can, you know, get the information they need on our return to school site?
Sure. Mr. Greenfelder, can you talk a bit about that for a minute? If we haven't updated it, we certainly can with our communications. We were working on a team to have all of those specifics. Mr. Greenfelder?
Yes, we can do that. We shared that out, and I can work with Ms. Caldwell to make sure that it's updated on the website. I'll do that in collaboration with Dr. Presidio because we'll make sure we include those co-curricular activities. I think that's probably where the confusion is. I think people know which athletic activities, but we'll make sure we work this evening and tomorrow and get that posted as soon as possible.
Thank you. I do appreciate that. Just want to make sure everybody has up-to-date.
Sorry for the delay. I should have taken care of that already.
No, no worries. Thank you so much. That's it.
Thank you, Ms. Pekarsky. Ms. Cohen, you are next.
I think, is Ms. Keys-Kamara's hand up from last time, or did she want to be put back in the go-backs queue? Oh,
it looks like
that might have answered it. Okay. Thank you. I wanted to put my co-meeting manager hat on for a second and just say, you know, I know that we earlier in forum had a conversation about governance and norms and all of that. So I think we have to take a hard look when we change, you know, midstream, if we're just going to start taking votes in work sessions, but that's for another day. I guess that being the case that we're going to take a consensus vote, my biggest advocacy is that I can only vote to support this plan if, Dr. Braybrand, if you are going to keep your foot on the pedal of making sure that our teachers are getting the support that they need. If you're going to work, Mr. Smith has done incredible work of trying to get with ANOVA and figuring out what teachers haven't gotten it and prioritize. But we have to keep going in both directions, full tilt of continuing to put pressure on to get those vaccines in people's arms, and also to make sure that folks have what they need in the buildings to be successful. I've reached out this talked to 20 of my principals, and they feel they are ready in their buildings to try this. And they all stress the word try. And we have got to stay on the data. We have got to be as transparent as humanly possible, and a lot more transparent than we have been able to be to this point. I think we have the resources to really be able to, in real time, share what's happening in our buildings. And we have to do that. Our staff and our families deserve to know what they are walking into. And so I need that commitment to be able to move forward here.
You have that commitment. I'm not going to quit. We've come this far. I'm not about to quit on the board or the community or FCPS. We will see this through, and I'll keep my foot on the monitoring the data. I want you to know we will have an email out to all of our staff today from ANOVA, making sure everybody gets one additional opportunity if they never signed up or registered, so that ANOVA can get them in. We want all of our people to take advantage of that opportunity and everything else. And we are going, this is only step one of getting out of this pandemic. We still have challenges ahead, and this is not going to be a time to just slack off. We're now going to have to turn our time and attention to doing this well, implementing it well. So I will keep that commitment, and I will honor that commitment to you and your board colleagues.
And, I'm going to be, driving you insane if I feel like that is not happening.
I am familiar with that approach, so I understand. I do. I understand.
Okay, I do want to take my final go back, and I do see Ms. Naren Kofax. I'll call on you process-wise after this. So first of all, Dr. Braybrand, as you know, Dr. Ivy was out of pocket when I asked the question from the feedback you all got from our elementary school principals. Were the 150 of them surveyed, or was it the feedback that you took to decide on grades 1st through 6th grade? Did that come from just the 23 members of the executive board for the Principals Association?
So it was reported to us that the executive board was unanimous and that they took it back to the larger group. They didn't give us an exact number, but they said that it was a broad consensus. And so we went further and also had conversations with elementary principals through the regions. And it was very, very clear that the majority were very supportive of that recommended timeline. And I say that there weren't some that were disappointed and that wanted a more aggressive timeline. Absolutely, I'm sure there were. But it was overwhelming support for the recommended timeline to give that additional week with the for the youngest students coming in first.
Thank you, Dr. Ivy. I do just want to share with my colleagues and the public, and certainly our hardworking principals across the division. I remain disappointed that we don't have a single school district that anyone's been able to demonstrate to me that we need a 2-week training time for kindergartners. I wish that we were simply having orientation time like our middle school and high school principals, many of them are doing for their newly arriving students who've never been in the building before. I'm disappointed that Loudoun County will have their K through 5th grade students potentially in a month before we will have ours. But I don't want that to diminish my deep appreciation, Dr. Braybrand, for the fact that you have been trying to lead your principals, lead your employees, and lead this board to get our students back into school. And so, as you know, that's where I'm willing to step in and support you on this, despite my disappointment. I just do want to also thank all the parents who did a tremendous amount of research on the 75 largest school districts and demonstrating to us that when 68% of elementary school students and well, 68% of basically K-12 public school students in the 75 largest school districts have been in some sort of in-person learning since September. It's time, and I'm glad we're going to finally get there. At this point, putting my meeting manager hat back on, I want to clarify a couple of things. One, Ms. Laura Jane Cohen and I worked really hard behind the scenes to make sure there would be clarity with today's work session, that it would be for discussion. It would not be for a vote. And I fully intended that we would honor that direction, that agreement to our colleagues, and the governance attached to that. During this meeting, I started getting text messages saying that it was recommended that we not take a vote on Thursday, that the board consensus is pretty clear. We want to bring down community anxiety about the uncertainty and therefore get consensus at the work session. So in fairness to the 12 of us, because we're a body and we're not individuals, I would ask that we first just no discussion, we take a vote. Do people want to go ahead and take consensus for today and report out the outcome at Thursday's business meeting? If they don't want that, then it would be returned to the original plan, which is that the board will formally vote on Thursday to approve the plan, but anyone certainly watching today, and Dr. Braybrand is hearing this, I'm sure, there is strong support for this timeline. So Ms. Cohen, if you want to weigh in, but it was, you know, other than that, I'd like to just go ahead and make sure it's not you and I or the chair usurping what direction we had agreed to and given the board.
I think it's totally reasonable to ask if people want to have consensus today or they would prefer to do it on Thursday.
Great. So again, being mindful that it's 4:30, we are 30 minutes over time. Board members, I'm going to ask you just that specific question. Do you support on a consensus vote now in the work session and a reporting out on Thursday evening from the two meeting managers about the outcome? If you do not support that, we will default to the original plan, which is to vote this Thursday on formally adopting the timeline proposed by the superintendent. So for those who would like to take the consensus vote now in the work session, please raise your hand. So, so far, the votes I see is Ms. Tolan, Ms. Corbett-Sanders, Ms. Rochner-Sizer-Heiser, Dr. Anderson, and Stella Pekarsky. That is 5.
Also, you have Ms. O'May. She's just up in the presenter since she shared a document.
Okay, so that's 6 who, and Mr. Frisch is 7. And thank you, Ms. Omish. We see you there. So now we're at 7 votes. I'm adding mine in there because I do think that it's important for our community to recognize where the board's going to go. And it just allows Dr. Braybrand to communicate sooner. Ms. Keys-Kamara, no, Ms. Marin, I'm sorry. I want to make sure, is your vote there to support this?
Yes, sorry. Thank you.
Okay, great. Okay, so at this point then, what I see is we've got the unanimous consent to proceed with the consensus vote on this. So we will now go to, again, just being formal and following governance procedures. I will now ask the board to please vote. Do you support?
Point of order, Megan. I'm sorry, Ms. McLaughlin. I did not put my hand up for that because I don't believe that's how we inform the community. So I'm a little uncomfortable with it, but thank you.
No
Ms.
worries.
McLaughlin, you said unanimous consent. I did not put my hand up either.
Oh, no.
You did use that word.
I
Maybe
did. If I said unanimous, that was not the word I meant. I just said we have consensus. We need 7 or more votes, and I believe that we ended up with at least 8 or 9. There was some changes in there, but the vote to proceed with this next procedural vote was there. So now we'll go ahead and vote to give consensus to the superintendent's proposed timeline as presented today. Please raise your hand. Okay, I will begin reading out the votes. Ms. Corbett-Sanders, Ms. Marin, Mr. Frisch, Dr. Anderson, Ms. Tolan, Ms. Omish, Ms. Pekarsky, Ms. Cohen, Ms. Rochner-Sizer-Heiser, Ms. Keys-Gamara, Ms. Dernak-Kofax, and myself. That is unanimous support, Dr. Braybrand, to proceed with the proposed timeline you presented today and to the public. And then, as I mentioned, Ms. Laura Jane Cohen and I will work with Chair and Vice Chair to ensure that when we report out that we capture the key points made by this board that ultimately has the authority, as I noted, for opening and closing schools. So Dr. Braybrand, I hope you can see that this was certainly a more positive overall outcome. And again, I do want to reiterate what I said at the beginning. There is deep respect from every one of us on the board for you, your leadership team, the principals, our teachers, all school-based staff, all hardworking employees This is not easy. We don't always agree on all the finer points, but I do believe that what today's work session demonstrates is a united board in saying that we support this school division moving forward with its best efforts to educate our children each and every day. We know they've been instructed virtually, and our teachers have done everything possible to make that positive. But this next step to returning to in-person learning for those who have elected it is critical. So Ms. Cohen, I just want to give you, as an awesome partner you've been, the last words for anything else you'd like to close out, since as meeting managers, we do have this unique privilege to have closing remarks.
No, I would just say, you know, we've given you the thumbs up to move ahead, and now the implementation phase begins, and you know that we're not going to let up on that. So we will stay in communication, and we'll look forward to receiving, you know, updates, especially when the survey comes back tomorrow and as we go through.
I just want to thank you all, Ms. McLaughlin, Cohen, for your leadership in this meeting managers today. And I want to thank the whole board. I am grateful, I'm humbled, and we will continue to work together throughout the next week, the next month, the rest of this school year, and to next year. And we are going to lean in and continue to do our very best to move Fairfax forward through this pandemic. And thank you all for your leadership today and your partnership with us. I am deeply, deeply grateful, more than I can express right now. So thank you all very much.
Thank you again, everybody involved in today's work session, and to my colleagues. Take note, on a return to school schedule, we were only 35 minutes over time. I think that's a really positive record. So I hope everybody has a wonderful evening, and thank you again, and good night.
Ladies, very well run session. Thank you.